Okay, chalo. So first of all, you tell me what is the answer here? Okay, chalo, fine. ठीक है. I can see that some of you are right, but some of you are wrong. Chalo, ठीक है. See, first of all, please understand that as per first chapter, second chapter, third chapter, like in this manner, I have framed the question. Fine. So first of all, like in the general psychiatry, please understand that how many questions you can understand, how many questions you can anticipate from the general psychiatry. Minimum number of questions which you are going to anticipate from the general psychiatry, that will be 2 questions. Fine now. Okay, so first of all, related to mood and affect. And after that, most important, related to thought process. Okay, now related to thought. Okay, fine. So here, like in the mood disorder, we are going to learn about depression, and in the thought, we are going to learn about delusion. Right? Like in the thought, we are going to learn about delusion. So delusion is a disorder of the thought. Fine. No? Delusion is a disorder of the thought. Fine. See, like in this question, a man is thinking about the events. A man is thinking about the events which led to his mother's death. Fine. No? He smiles when he describes the same events to his friend. Okay, fine. See here, like what is happening is, see, when I talk about mood and affect, see, suppose if we are going to frame the question like in one liner, mood and affect, right now? Mood and affect. See, mood and affect both are similar words. Both are similar words. Mood and affect describes emotions. Emotions, right now? Emotions. Right, mood and affect. But do understand what is the difference between mood and affect. See here, affect means short-term emotion, short-term. Mood is long-standing. Suppose if a patient comes to you and suppose if a patient is there, like in front of you, like in your OPD, and if patient is saying that, sir, you know what, for last 1 month, I was very, very sad, but now I'm smiling. Okay, now I'm smiling when I see you. Now I'm smiling. Now external appearance, short term is affect. Now I'm smiling. For last 1 month, I was sad. So 1 month of sadness is called as a mood. Fine. So okay, now the question is that, see, first of all, we are going to understand related to mood. One is called the fluctuation of mood. Fluctuation of mood. Fluctuation. Okay, fluctuation of mood. Second is called as appropriateness of emotion, right now? Fluctuation of emotion. And second is called as appropriateness. Appropriateness. Okay, fine. Fluctuation and appropriate. When I talk about appropriateness, see here, appropriateness is related to social, related to society, related to external stimuli. Means suppose if a person is going to graveyard, suppose if a person is going to graveyard to attend a funeral part, right now, and after that he's laughing, he's smiling, he's saying everyone, hey, wow, what a gathering here, man. This is inappropriate. Inappropriateness of emotion, right? Now you cannot laugh in graveyard. Fine. No? So when I talk about related to external, that is appropriate or inappropriate. Okay, fine. But when I talk about one important point here, related to congruency. See here, whenever speech and thought of a person is matching or not. Speech of a thought, see here, like speech of a person is matching with the thought of a person or not. That is called the incongruency or the congruency. Suppose if a person who is suffering from depression, right now, suppose if a person who is suffering from depression, see now, suppose if he is saying that, yeah, everyone is going to die. Everyone is going to die. I'm going to die. My father will die. My mother will die. Okay, fine. See, this is completely matching. Okay, this is going to synchronize with his emotion and the thought, speech, everything is synchronized. Right now, but if a patient of depression is saying that I'm the richest man on the earth, incongruent. It's not matching with his emotion. Right now, see, speech and thought, these are not matching. This is what? It is called a what? Incongruency of emotion. In the same manner, when a boy or a man, like in this question, if he wants to express, if he wants to inform about the death story of his mother, he should be very, very sad, no? Right now, he should be very, very sad. But suppose if this man, when he's going to speak, when he's going to, if this man, when he's going to explain about the mother's death, when he's saying to his friend that, hey, you know, one day my mother was driving Audi, she was driving very, very fast. And suddenly from the opposite side, there was a bus and Audi, but they collided like this and boom, what an accident there, man. Oh my God. He's smiling. He's expressing a lot. See, this is what? Incongruency of emotion. Incongruency of affect. Easy to understand? Okay, chalo, fine. Very good, very good. So please understand that, see, this question is extremely important. When I talk about emotion, first of all, I have explained you about appropriateness of emotion or inappropriateness of emotion. Appropriateness and inappropriateness are related to society, related to social gathering. Suppose if a person who is going to disco and after that everyone is dancing there, right? Everyone is singing and dancing. And if this person is shouting, hey, why you people? Okay, why you people are dancing here? Why you people are laughing here? Fine. Now, this is also inappropriateness of emotion. Okay, no? When thought and speech are not matching, thought and speech are not matching, are not synchronizing, that is called as incongruency of affect. If these are synchronizing, matching, then this will be congruency of affect. So question number 1, answer is B. Next is fluctuation of emotion. See here, fluctuation of emotion means what? How emotion is being fluctuated here. Fine. How emotion is getting fluctuated. One is called as emotional labile. One is called as emotional labile. Repeatedly asked question in MCI. Repeat. Please understand that when I say emotionally unstable, or emotionally labile or lability, both are same thing. Suppose if a person who is laughing at one time and shouting at another time, ek bar ro raha hai, ek bar has raha, laughing and crying, laughing and crying, laughing and crying. This is what is emotional labile. Emotional labile. Old question, repeatedly asked question related to emotional labile, emotional unstable. Opposite is affective flattening. Affective flattening. Flattening का मतलब क्या होता है? Flattening का मतलब flat हो जाना, है ना? Flattening का मतलब flat. Meaning of flattening means what? Flat. When I see, this is ECG, right? No, ECG. Okay, fine. So ECG है ना, like some, but ECG will be like this. Flat ECG means dead person. Flat emotion means no emotion, zero emotions at all. Affective flattening. Affective flat. Dr. Ajit, yeah, I will explain that. Don't worry. Okay, fine. Okay, fine. So please understand the affective flattening means no emotions at all. है ना? बिल्कुल. अच्छा, Dr. Akash. Okay, fine. See, now one student is one doctor is asking why option D is not right here. See here, inappropriateness of mood means what? Inappropriateness means, see here, no, inappropriateness is related to social gathering. I gave you the example of graveyard and disco. Fine, no? Easy to understand? So as per the social appearance, as per the society, right now, how do you express your emotion? That is appropriate or inappropriate. Laughing in graveyard, inappropriateness of emotion. I hope all these points are completely clear. Okay, no? Okay, Dr. Tunu, see here. Like you are asking, what is the difference between emotional labile and bipolar disorder? See, bipolar is completely different. See, bipolar, see, for some time, like he will be depressed. Okay, and sometimes he will be maniac, right? Now, manic, so those are completely different. Mood disorder here. Emotional labile means what? See, only for the time being. Now I'm laughing. Suddenly after that, I started crying. Okay, laughing and crying, laughing and crying. See, mania and depression are complete, extreme level of thing, right? Okay, fine. Chalo. Next question. See, always understand, please understand that emotional, labile, and affective flattening, these two are extremely important. Okay, next question. Actually, we are going to discuss some more points related to emotions. Now, you tell me, see which part of brain helps in the production of emotion. Can you answer me, please? See, which part of brain is responsible for the generation of emotion? Limbic system. See, limbic system. Okay, no, limbic system. So how many structures are there? Matchbox, right? No, MATCH, limbic system. Mammillary body, amygdala, thalamus, cingulate gyrus, hippocampus. But when I talk about which part of brain regulates the emotion, what is your answer then? Regulation by frontal lobe. Please understand, don't get confused. Limbic system is factory house, generates the emotion. Frontal lobe regulates the emotion. Fine. Next, so related to emotion, related to affect and mood, two important points. One is called as anhedonia. Second is called as alexithymia. Anhedonia means what? Inability to experience pleasure in old activities. मतलब पहले मजा आता था, अब नहीं आता है. Earlier I used to enjoy playing soccer a lot, but now I'm not enjoying. Inability to experience the pleasure in old activities is called as anhedonia, frequently seen in depression case. Or in a case of schizophrenia, negative symptoms. Second word is alexithymia. Inability to understand the emotion of other people and express the emotion of own. See here. So basically, lack of words to express the emotion. Inability to express and understand the emotion is called as alexithymia. So see, you can ask me, sir, alexithymia and affective flattening, right? Both are similar. Affective flattening, because see, like examiner would like to play with your knowledge. Fine. No, affective flattening and alexithymia. See here, how to differentiate affective flattening and alexithymia. Affective flattening, zero emotion. Alexithymia, emotions are there, but he's not able to understand, he's not able to express it. Fine. So you can have one example here. See, like, so there are two sons, A and B. So two brothers are there. Okay, see, they lost their father. See, the dead body of their father is in front of them. Both are standing. One is having at least one drop of the tear. B, no tear at all. Hana? See here, A is having only one drop of tear. That's it. B, no tear at all. A is affective flattening or alexithymia. Can you answer me? A is having one drop. So A is what? Alexithymia. He has some emotion, but he's not able to express it out because of lack of words. But when I say no tear at all, he is standing very, very much silently there. So that is what? B will be what? B will be so B will be what? Affective flattening. I hope this is clear to all of you. Please understand that anhedonia, alexithymia, affective flattening, and emotional labile. These 4 words repeatedly asked question in MCI. Next question, please. See here, a 33-year-old clerk behaves as if he is the district magistrate. He visits all the municipal corporations and giving multiple instructions to all the staffs, but no one is listening to him. He's getting angry and shouting on everyone. Finally, police arrested him and brought him to custody. Now he is shouting on all the police as how can they arrest a district magistrate? Which of the following statement is incorrect? I'm asking what? Incorrect. So now you tell me देखो पहले ये बात बताओ कि what is the diagnosis here? First of all, you tell me what is the diagnosis. Overall, first of all, you tell me what is the diagnosis here. Yeah, this is delusion of grandiosity, right now. Delusion of grandiosity. So now you tell me delusion is a disorder of thought or perception. है तो delusion ना? देखो, this was very easy question, right? This was very question. See, I'm asking you about which one is a wrong statement. No? Wrong. I'm asking you wrong statement. Batao, wrong incorrect. So please understand that what is the meaning of delusion. Delusion is this is a false and unshakable belief. If a person is thinking that I'm the most powerful person on the earth, so it means what? He's suffering from delusion of grandiosity. Delusion is a disorder of content of thought. Content of thought. Content of thought. Always understand that. See here. Now you tell me, see, so which of the following is wrong? This is a disorder of the perception. No, this is not a disorder of the perception. Perception means what? Hallucination and illusion. So wrong answer is A. Easy to understand? Fine. Now, do understand here. See, please understand here. See, delusion is a disorder of thought, especially content of thought. When I talk about insight, insight means what? What is the meaning of insight? Insight means awareness about disease. If I'm suffering from malaria, okay, suppose if I'm suffering from malaria, fine, no, malaria. So malaria means what? So what is happening if I'm having fever, up and down? I know that I'm suffering from a disease. It means insight is present. But if I'm suffering from delusion or hallucination, I don't know that I'm suffering from any disease, right? No. So it means what? Insight is absent. Here, this is also correct. Next word is very important. That is called as ego syntonic. Don't get confused here. Related to ego syntonic, they can ask you two questions. They can frame you two questions here. Ego syntonic and ego dystonic. See, what is the meaning of syntonic and dystonic? Never get confused between syntonic and dystonic. Syntonic and dystonic. See here, see when I'm saying that if a person is a gay or a lesbian, this is normal or abnormal? Fine. If a person is a gay, this is normal or abnormal? Fine. Suppose, see here, suppose if a person is gay, he is thinking that, okay, no problem, I am a gay, I can have sex with a man, no problem at all. I don't care about society, I don't care about family members, no problem at all. It means what? Whatever sexual orientation he is having, it satisfies his ego. He is completely normal. If he does not find anything wrong, if he does not find anything wrong with his sexual orientation, this is called as ego syntonic. Syntonic means sab sahi hai. Everything is fine. Everything is fine. But suppose if a person is gay and after that he's thinking that, oh my God, I'm a gay. What my family will think, what my society is going to think. Oh my God, I'm not going to, oh my God, I will not be able to marry a woman. I'm not going to please a female and all. Fine. No. Oh my God, I will not be able to become a father. Oh, because of all these things, if he's getting anxiety, it means what? It does not satisfy his ego. Everything is not right with his feelings and all. That will be considered as ego dystonic. Dystonic. Easy to understand? Fine. No? Suppose if a person who is having delusion of grandiosity, suppose if a person who is having delusion of grandiosity, DOG, and if a person is having OCD of contamination, OCD of contamination, right? OCD of what? Contamination. Do understand? See, psychosis and neurosis. Repeatedly asked question. Very important question. If a person is having delusion of grandiosity, delusion. If a person is having OCD of contamination, I know. See, now, if a person is having this kind of thought, oh my God, your hands are dirty, your hands are dirty, your hands are dirty. He knows that these thoughts are irrational. These are, okay, these are not the relevant thoughts. So whenever he's having this kind of thought, see, after that, if he is not washing his hands, he will be getting what? Anxiety. So to reduce his anxiety, he has to wash his hands again and again, again and again, again and again, at least for 40-50 times in a day. He knows that because of this, he is wasting so much of his time, so much of his precious time. Because of this, he can easily go into depression. He's going into depression. He knows it here, right? No, he knows it. So it means what? He is aware about his disease. Awareness about disease is called as insight. Insight. Insight will be present in OCD of contamination. Insight will be absent in delusion of grandiosity. So where insight is absent, it is called as psychosis. Where insight is present, it is called as neurosis. When I talk about only anxiety, see here, anxiety, phobia, OCD, all these are, see, panic attack and all these are the neurosis. Okay, now, but when I talk about delusion and hallucination, schizophrenia, bipolar, here person does not know that he is suffering from any disease. So these are called as psychosis. Psychosis. Please remember one word that is called as insight. Insight will be absent in psychosis. Insight will be present in neurosis. Do remember these two important words. Okay, chalo, fine. Alzheimer's disease, Dr. Ali Beksi, that is organic mental disorder. Organic mental disorder, there will be multiple disorders. See here, you do understand here. Organic mental disorder and non-organic mental disorder. Non-organic mental disorder. Organic mental disorder, whenever there will be insult of brain parenchyma. If you do CT scan and MRI, CT scan and MRI, there will be some changes in brain parenchyma. Right now, so that is called as organic mental disorder. Right now, so like after head injury, or maybe, you know, like something like Alzheimer's and Parkinson's. Right now, so these are organic mental disorder where a person will be suffering from dementia. So their person will be aware that they are suffering from some disease for sure. Right now, but non-organic mental disorder, if you do CT scan and MRI, no changes at all. No changes at all. Fine now. So that is called as non-organic mental disorder. I can say disease of brain is called as organic mental disorder. Disease of mind is called as non-organic mental disorder. Non-organic mental disorder is divided into two parts, psychosis and neurosis. Non-organic. Psychosis, absent. Neurosis, it will be present. It will be present. Now, what about judgment power here? If a person who is thinking that I am the Bahubali, I am the most powerful person on the earth. Problem with delusion of grandiosity is that wherever he will go, he will start behaving like he's the most powerful person on the earth. Everywhere. So judgment power will be abnormal in psychosis. But if a person who is suffering from neurosis like OCD of contamination, right now, OCD of contamination, I don't know, OCD of contamination. Fine. No. So whenever, like, suppose if he's going to use a public toilet, no, he will be very, very much cautious. No, suppose if I'm going to use, suppose if I'm going to wash my hands, now after that, everyone will, okay, now everyone will have to wait for so long, right now. So now, see here, in a case of OCD of contamination, judgment power is normal. He is in contact with the reality. He understands, but delusion of grandiosity, reality testing absent, absent. Remember all these points here. Okay, now see, related to psychosis and neurosis, you can anticipate one question. Related to ego syntonic and dystonic, very, very important word, syntonic and dystonic. When I talk about personality disorders, all personality disorders, all personality disorders, These are ego syntonic. If any of your friends who is suffering from any personality disorder, if you tell him, hey, your behaviors are abnormal, you need a psychiatrist, he will scold, he will fight with you. He thinks that he's completely normal. When a person is thinking that he is 100% all right, he is normal. Ego syntonic. Ego syntonic. I hope all these words are clear to all of you. And please remember that, see here, delusion is a disorder of thought. But when I talk about how do I perceive something, perception, illusion, hallucination, and autoscopy. Illusion, suppose if a rope is there, if a person is getting scared that, oh my God, there is a snake. False perception of a real object. One object is there, stimulus is there, but he is having false perception. Illusion, nothing is there, he can see something. Hallucination, nothing is there. I'm standing in operation theater, suddenly I'm asking my nurse what this buffalo is doing here. There cannot be any buffalo. I'm having what? Visual hallucination. Fine now? So now you tell me, see, different types of hallucination. So what is happening here? Suppose if I'm standing in operation theater, I'm asking my nurse why this buffalo is singing a song for me. There is no buffalo, but I can hear that buffalo is singing a song for me. Auditory hallucination. There is no buffalo, but I can see a buffalo. Visual hallucination. I'm using a public toilet, and after that I'm see here, no, like the public toilet, ammonia smell. There I'm going and I'm asking, hey, wow, what a good fragrance here, right? Olfactory hallucination. I'm having sweet, gulab jamun, oh, salt. Gustatory hallucination. I'm feeling that some insects are walking under my skin. Tactile hallucination. Now you tell me, where do you see tactile hallucination? Can you answer me? Related to substance poisoning, repeatedly asked question. Tactile hallucination, especially in cocaine abuse. Cocaine. Okay, no, tactile hallucination. Hallucination of the touch, right? No? Fine. Okay. See, this is not seen only in cocaine, also in alcoholism, alcohol also. Where do you see olfactory and gustatory hallucination? Whenever there will be temporal lobe disorder. Autoscopy means what? Autoscopy. If I can see my own imagination. I'm standing here. I can see that one more Dr. Nadeem is standing in front of me. That is autoscopy. Do you remember? See, when I talk about depression, mood, depression is a disorder of mood, emotion. Delusion is a disorder of thought. Hallucination and illusion, these are disorder of the perception. Don't get confused here. So now you tell me, now is it easy for you to see? Now you tell me, is it easy for you to solve this question? Overall, whenever there will be long question, diagnose the case. Delusion, ego syntonic, insight is absent, and this is a disorder of content of thought. This is not a disorder of perception. Next question here. A person is asked about his blood sugar level. He answers, diabetics have sweet urine. Urine and feces are excreta. Even normal person excretes every day before finally telling his blood sugar level. What is the answer here? Most of you are wrong. Dr. Shubham, very good. Dr. Vignesh, very good. Dr. Arya, very good. Dr. Lavanya, chalo theek hai. See, I can see that most of you are wrong in this question. Dr. Sankar, very good. Chalo theek hai. First of all, you tell me, what is the diagnosis here? This is a circumstantiality disorder or tangentiality disorder. Very good. Chalo, see, when I talk about, see here, so basically, see, if I ask you one question, what is the clinical examination being done in a psychiatric patient? What is the name of clinical examination which we perform in a psychiatric patient? That is called as mental status examination, right? So MSE, mental status examination. No, Dr. Akash, this is not mini mental. See, one is called as MMSE, one is called as MSE. Don't get confused in these two. Mental status examination, this is the clinical examination of a psychiatric patient. But when I talk about mini mental status examination, this is especially for organic mental disorder. Especially for organic mental disorder, like, like whenever there will be delirium and dementia, right now, which you have seen in Alzheimer's disease, Parkinson's disease, right now. I know. So there we have to, whenever we are going to check the mini mental status examination, that is especially for organic. Fine. But overall clinical examination for a psychiatric patient is what? Mental status examination. Mental status examination. So what do we check in mental status examination? First of all, we check what? External appearance. How does he appear? Whether he is well groomed or he is not maintaining high. He is wearing bad clothes or dirty clothes. Next, speech, rate and tone of speech. He is speaking very, very fast. Mania. He is not speaking at all. Depression. Right now? Speech. Third, I want to check the emotional level of my patient. Mood. Okay, now if I have to check the quality of emotion, I will check whether my patient is very, very happy. He is laughing, he is jumping without any reason. That is called as euphoria. That is called as euphoria. Opposite is depression. Opposite is depression. Mood देखना है मुझे, तो पहले मैं क्या देखूंगा? See, whenever I have to check the mood of my patient, first of all, I would like to check the quality of emotion. Depressed or euphoric, very, very happy or very, very sad. After that, I would like to check the fluctuation of emotion, emotional labile or affective flattening. After that, I would like to check about the congruency of emotion. Speech and thought are matching or not, incongruent or congruent. After that, I would like to check about appropriateness of emotion, social gathering, appropriate, inappropriate. After that, I would like to check about perception of my patient. How does my patient perceive anything? Illusion and hallucination. After that, I would like to check about thought of my patient. Thought. How actually my patient is thinking. Easy to understand? Fine now? So this is most important point here related to thought, because one question you can anticipate from thought. Okay, now one question you can anticipate from thought. After that, we are going to understand insight, whether my patient is aware about his disease or not. I want to check about his higher mental function, attention, concentration, and all, right? Chalo, fine. So now do understand related to thought here, See, there are four types of the thought disorder. One is called as a stream of thought. Second is called as form of thought. Third is called the content of the. See, if you are able to recall, please write in the box here, because see, like if you are writing, it means you are able to recall everything. Stream of thought, form of thought, content of thought, and fourth is called the possession of thought. So first of all, we are going to discuss about, see here, like a stream of thought means for a stream of thought, like either there will be what? Flight of ideas, flight of ideas. Second is what? Inhibition of thinking. Inhibition of thinking. Next, most important is the form of thought. Form of thought. See here, related to form of thought, you can understand one, okay, at least one question you can anticipate. Okay, one question here. Form of thought. Form of thought. See, when I show you my phone, okay, this is rectangular. Okay, fine. When I show you a glass, like this will be cylindrical. In the same manner, okay, there should be well organization and the association between two thoughts. If there will be loosening of association, if two thoughts are not interconnected, it means formal thought disorders are there. Formal thought disorder. Fine. So there are different type of form of thought disorder. Very, very important. Please remember all these points. Derailment. When association between two thoughts is disturbed. When association between two thoughts is disturbed. It is called as derailment. Suppose if you are asking a patient, what do you know about history of India? Patient is saying that, yeah, Pandit Nehru was the first Prime Minister of India. Sachin scored century. Two thoughts are not associated. He was going on a rail, suddenly he got derailed. This is called as derailment. How you are feeling today? You are asking your patient how you are feeling today. I am hungry, it will rain today. Connection is lost between a single component of a thought, single thought, loosening of association. Whatever patient is saying, where do you live? I live in America, software, Mark Zuckerberg, Bihar, UP. What does it mean? Incoherence. Whatever patient is saying, you are not understanding. Now, most important is circumstantiality and the tangentiality. These two words you are not going to forget. Circumstantiality and tangentiality. Circumstantiality and tangentiality. Circumstantiality means what? See, suppose if a senior has asked one intern which specialization you want to take in your PG, and after that he's saying that, sir, when I was second year I was liking pathology a lot. When I was in third year I started liking PSM. After that, when I joined pediatrics department, I started liking pediatrics department. So, but when I joined surgery department, there I saw, sir, actually surgeons are playing with blood. Sir, actually I want to become a surgeon. See here, unnecessary details, round and round, round and round. But finally he will answer you. That is called as circumstantiality disorder. Circumstantiality disorder. Second is called what? Tangentiality disorder. Tangentiality means what? Answering in a distant related manner. You are asking a patient, who is your favorite actor? He will say, Bollywood is all about Bollywood is all about romance. Hollywood is all about action. Answering in a distant related manner. Tangentiality. You ask your patient, what do you know about Albert Einstein? He will say, science is a branch of a study which is based on research and experiment. Answering in a distant related manner. Tangentiality. Tangentiality. Circumstantiality, unnecessary details, right? Unnecessary details, right? Very good. Tangentiality. Okay, fine. See here, neologism. Neo means what? New. Neologism. Coining of a new word. Suppose if a 15-year-old boy is there, he is asking his mom, Mom, please give me my Rindin Rapa or Tintin Tapa, whatever. So after that, the mom is, what do you want? Mom, I want my Tintin Tapa. What? Mom, I want my Tintin Tapa. Just now I coined a new word for pen. Acha, you wanted to have a pen. See, coining of a new word is called as neologism, frequently seen in schizophrenia. Schizophrenia. Metonyms, word approximation. Using old word in an inapproximate manner. I'm standing in operation theater. I'm asking my nurse, okay, Sister Ji, I need my hand socks. Basically, I want surgical gloves. I need hand socks. Hand socks. See, for my eyeglasses, I'm saying I need my eye cover. Eye cover. For my wristwatch, I'm asking I need the time vessel. This is what? Metonyms. Clanging. Using words which sound similar. If you are asking a patient, how you are going to clarify about fragrance, absence, nonsense, flatulence, everything makes no sense. This is called a fragrance. What does it mean? See, clanging, similar sounding, perseveration, unnecessary repetition of same thing. You are asking a patient what is your name? Rahul. What is the name of your father? Rahul. Where do you study? Rahul. So where do you stay? Rahul. So what does it mean? Unnecessary repetition of same thing. This is called as perseveration. Always remember, formal thought disorders are classically seen in schizophrenia. So now you tell me in this question, what we have learned here in this question, see here, no? Sweet urine feces are excreta, even normal person excretes before finally telling the blood sugar level. This is what? Circumstantiality. Diagnosis is what? Circumstantiality disorder, which is a disorder of form of thought. I hope this is clear to all of you. Next. A manic patient, when asked about hometown, he said, I live in Kolkata, I wear the shoes of Bata, watch of Sonata, I ate the cake, Pinata, leave me alone, bye-bye, tata, tata, tata. ये क्या है बताओ? So most of you have written what? Clanging, right? But please understand that there is a small difference between flight of ideas and clanging. And after solving this question, नहीं, Dr. Akash ने यहाँ पे अभी देखो इसको, ठीक है? देखो, please understand that how to differentiate flight of ideas and as you can see that words are rhyming, similar words दिख रहा है ना, similar है. Do understand that? Repeatedly asked question, old question MCI. After getting discharged from hospital, a patient is saying that I'm having so much money. I'm going to buy honey for my sweet Sunny. Honey, money, Sunny. Kya ye rhyming words? But you can understand, no? How thoughts are flying. How thoughts are going to follow each other. This is what? Flight of ideas. Rhyming words, you can understand. I live in Kolkata. I wear the shoes of Bata, watch of Sonata. I eat the cake Pinata. Leave me alone. Bye bye. Tata tata. Kya hai ye? Flight of ideas. Rhyming words, but flight of ideas. Right now? है ना? अगर वो एग्जांपल दिया था last time during the class, okay, you are asking your patient, where do you stay? I live in Delhi. I have a cat. She has big belly. She loves to eat jelly. Lily. So this is what? Flight of ideas, which is a disorder of stream of thought. But when you are asking a patient how you are going to clarify fragrance, absence, nonsense, flatulence, everything makes sense, you are not understanding the real meaning. That is called as clanging. Rhyming words, not able to understand. Clanging. Rhyming words, you can understand the meaning. Flight of ideas. I hope this is clear to you now. Everything is clear now. इसमें गलती नहीं करना. You are not going to make any mistake here now. ठीक है? Fine. See here, circumstantiality and the tangentiality. Please understand that. देखो ये दोनों word में ना, after that these two are extremely important. Circumstantiality and tangentiality. देखो देखो ये दोनों में कभी मिस्टेक मत करना इसमें, ठीक है ना? सी इफ आई एम मेकिंग सर्कल लाइक दिस, ये सेंटर है. Giving unnecessary details, but finally he will answer you. Goal is reached. Circumstantiality. When you were in class 9th, you have learned about a word in mathematics that was a tangent. है ना? कि one line is going to touch one point of circle, and after that this will go forward, right? Now Fine. No? See, this is not going to touch the center. Only 1 point दूर से बोल के निकल गया. Distant related answer, that was called as, okay, that was called a what? See, this line is called the tangent. Going to touch a circle. Only at 1 point. Who is your favorite actor? See, you are asking your patient, who is your favorite actor? He's saying, Bollywood is about romance, Hollywood is about action. He is answering you in a distant related manner. He is not giving you direct answer. That is called as tangentiality. Tangentiality. This is A, this is B. A is circumstantiality, B is tangentiality. B is tangentiality. These 4 words, these 4 examples now very, very important. These 4: circumstantiality, tangentiality, flight of ideas, clanging. Repeatedly asked question in MCI. Flight of ideas mein kya hoga? See, stream of thought. Rhyming words, but you can understand the meaning. Fine? Very good, very good. Yes, 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 Dr. Sandy. Clanging, rhyming words, but you will not be able to understand any real meaning. That is called the clanging. I hope this is clear to all of you, right? है ना? तो ये क्वेश्चन नंबर 4 का आंसर क्या होगा यहाँ पे? Answer will be C, flight of ideas. Next. A husband believes that his wife has extramarital affair. He always keeps eyes on her phone and all the guests whoever visit the home. Due to all these, he frequently fights with his wife, but he works normally in office, greets everyone, and he behaves in a gentle manner. He is suffering from, so basically diagnosis batao kya diagnosis kya hai? This is a delusion of what? Delusion of infidelity. Very good. Delusion of infidelity. Delusion of infidelity. Delusion of infidelity, which is also called as morbid jealousy. A jealousy which is also called as pathological jealousy. Pathological jealousy. A jealousy which has become disease, which is also called as a novel written by Shakespeare, which was based on what? Cheating on a spouse. Othello syndrome. Othello, right? Othello syndrome. Othello syndrome, right? All delusions are extremely important related to your exam. So let's have a fast revision of all the delusions. See here. See, when I talk about delusion of persecution, overall, do understand when I talk about, see, there are 4 types of disorder of the thought. 4 types of the disorder of thought. One is called the stream of thought. Okay, please give me 2 examples of a stream of thought. Stream of thought ka matlab kya ho gaya? How one thought is going to follow the other thought. Flight of ideas. One is called the flight of ideas. Series of thought that will come into mind. Flight of ideas. And multiple ideas, multiple thoughts. Opposite is what? Inhibition of thinking. He's not thinking at all. Form of thought we have learned. No, whenever there will be what? Dissociation between 2 thoughts or the component of thoughts, like derailment, loosening of association, circumstantiality, tangentiality, neologism, clanging, metonyms, perseveration. Content of thought. Content of thought means delusion. What is the actual content of thought of my patient? Actual content. Fine, no? So content of thought disorder is delusion. Never get confused here. Repeatedly asked question. Delusion is a disorder of content of thought. 4th point is possession of thought. When a person will be thinking that my thoughts are being possessed by someone else, or my thoughts are under the control of other people. My thoughts are under the control of other people. That is called as thought alienation. Thought alienation. Very good, Dr. Yelabili Sarika. Thought alienation, like thought insertion. Very good, Dr. Karthik. Insertion, withdrawal, thought withdrawal, and thought broadcast. Broadcast. And last is obsession. Obsession. Chalo, fine. So let's discuss all the delusion first, and after that we can proceed further. Okay, no? So delusion is a disorder of what? Delusion is a disorder of content of thought. False and unshakable belief. If a person is thinking that someone wants to harm me, someone wants to kill me, delusion of persecution, delusion of persecution. Overall, this is the most common type of delusion in psychiatry. Even in schizophrenia, this is the most common type of delusion, delusion of persecution. Next is delusion of reference. Whatever is happening in and around, whatever is happening in and around. Suppose if a person is standing in a hall and suddenly one AC fell down, after that he will say that, oh my God, just now I kept my hand in my pocket, that's why AC fell down. Whatever is happening in and around, patient will think that he will refer himself that this is happening because of me only. Even if some other people are talking, oh, they're talking about me. Reference. Delusion of love. If a person is, if a rickshaw puller is thinking that Aishwarya Rai is in love with him. Delusion of love, fantasy lover syndrome, also called as erotomania, also called as de Clerambault syndrome, delusion of love. Delusion of grandiosity. I'm the richest person. I'm the most powerful person. Fine, no? Grand, feeling of being grandest, grandiosity. Delusion of negation. Negation means what? Nihi, negative, negation. If a person is saying that aliens have stolen my brain, if a person is claiming of non-existence of something, that is called as delusion of negation. Negation. Cotard syndrome, also called as Cotard syndrome. Third, next is delusion of infidelity. If a person is thinking that, if a husband or wife is thinking that his or her spouse is having extramarital affair. I know, false belief of the partner or spouse who is having extramarital affair or extra affair. That is what? Delusion of infidelity. Cheating on a spouse. Also called as morbid jealousy, pathological jealousy, okay, Othello syndrome. So if husband is having delusion of infidelity, fine, finally there will be divorce. But if a wife is having delusion of infidelity, she's not going to leave the husband. But one day she is going to amputate. She is going to amputate the genital organ of male partner. That is called as what? One day she is going to cut the genital organ of male partner. That is called as Bobbitt syndrome. That is called as Bobbitt syndrome, where a female partner is going to amputate the genital organ of male. This is called as Bobbitt syndrome. Bobbitt syndrome. Delusion of enormity. When a patient is believing that some of his action can cause a disaster reaction, what is happening? Suppose if a person is having this kind of thought, no, okay, if I am going to sneeze openly or if I'm going to cough openly, entire city of Delhi will be blown away. So if he has to, suppose if he's going to cough, right? So he will be doing what? He will not be coughing openly because he is thinking that if he's going to cough openly, entire city will be blown away. Delusion of enormity. Delusion of guilt, feeling of guilt. 15 years back, your friend has borrowed only 1 rupee from you. Now he is coming to, he's saying, hey, that time, no, when we were in school in 2nd, 3rd class, no, I borrowed 1 rupee, but I could not get you. I could not return you, man. I think I have committed the biggest sin of my life. Okay, the God is not going to forgive me. Severe delusion of guilt is seen in extreme level of depression. Depression. Here the picture number 1 is what? Picture number 2, picture number 3, picture number 4, picture number 5. Picture number 1, a cat and lion, delusion of grandiosity. Picture number 2, someone wants to Kill me, delusion of persecution. Yeah, they talk about me, delusion of reference. See here, male partner, even if she is sleeping, phone checking, no, delusion of infidelity. Picture number 4, delusion of infidelity. Picture number 5, half part is non-existing, delusion of negation. तो अब बताओ क्या था आंसर यहाँ पे? So this is delusion of infidelity, which is called as Othello syndrome. If I ask you, see here, a fantasy lover syndrome. What are the other names of fantasy lover syndrome? Erotomania, delusion of love, and Clermont syndrome. These two are same only, right? What are the other names of Cotard syndrome? Cotard, delusion of negation and nihilistic delusion, right? Fine, chalo, very good. Next question, which of the following is a wrong statement related to hallucination? So first of all, see, please understand what is the meaning of the hallucination. See here, in the absence of any stimulus, if a person is going to hear something or see something, that is called as hallucination. Easy to understand? Hallucination. So first of all, there are 4 criteria to diagnose hallucination. First of all, it occurs in the absence of any stimulus. See, there is nothing, but a person can see something. It is as vivid as the real. Suppose a patient is standing in front of me, he will say, yes, doctor, you are wearing white shirt and the glass, you have a mole over your left cheek. But if patient is saying that, I'm not sure whether you are wearing a white shirt or green shirt. If he is not sure, this is not a vivid. As vivid as real, matlab kya? Exactly same. Experienced in outer objective space. Patient will say that, yes, sir, I can hear some voices, but these voices are coming from out of the wall. Bahar se aa raha, from outside it is coming, not from my own body. If a person is saying that, yes, sir, I can hear some voices, but these are originating within my own mind, inner subjective, that is not the real hallucination, that is pseudo hallucination. This will always be involuntary. These are the 4 criteria. On the basis of these 4 criteria, you can anticipate one question. Fine now? Yes, pseudo hallucination, inner subjective space. Very good. So now you tell me here, see, this is as vivid as a real perception. Yes. It occurs in absence of any perceptual stimulus. Yes. It is independent of the will. Yes, this is involuntary. It occurs in inner subjective space. No. Outer. Fine now? So see, like option number D means what? Pseudo hallucination. Pseudo, false. So D is false. D is wrong about hallucination. Now see, there are 4 special types of hallucination. One question you can anticipate here. One is hypnagogic. One is hypnopompic. When I talk about hypnagogic, remember only go. Before going to bed, if a person is getting hallucination, or before sleeping, hypnagogic hallucination. But before getting up, if a person is getting hallucination, hypnopompic hallucination. These 2 are seen in sleeping disorder like narcolepsy. These 2 are seen in sleeping disorder called as narcolepsy. Excessive sleepiness in daytime is called as narcolepsy. What is the drug of choice for narcolepsy? Modafinil. So if I say that a person is getting hallucination at 9 p.m. This is hypnopompic or hypnagogic. Night time, right? This is hypnagogic. If I say that if a person is getting hallucination at 5 a.m. means hypnopompic. Hypnopompic. These two are seen in sleeping disorder. Next, synesthesia, which is also called as reflex hallucination. One is synesthesia, second is functional hallucination. See here, synesthesia means what? Stimulus in one modality, hallucination in another modality, synesthesia. Like if a person is saying that, sir, whenever I look at the tube light, I start hearing the voices of God. Stimulus in visual modality, hallucination in auditory. This is called as synesthesia. Synesthesia. Second is, see, like in a different manner, I can say that whenever there will be crossing of senses, if a person is saying that I can hear light, I can hear light, I can watch music, I can watch music. This will be seen in the intoxication by bhang and ganja. I can hear light, I can watch music. This is what? This is also a type of synesthesia seen in cannabis intoxication, LSD intoxication. Easy to understand? Functional hallucination. Functional hallucination. Stimulus in one modality, hallucination in same modality. Patient will say that, sir, whenever I'm hearing tick, tick, tick sound of a wall clock, I start hearing the voices of God. Stimulus in auditory, hallucination in auditory, functional. These are 4 special types of hallucination. Please remember all these points. See, I will share this PDF, don't worry, okay? Now, next, a clinician is asking a patient, what will he do if he sees an addressed envelope lying on the ground? And patient is replying that he will kick it somewhere else. What does it mean? So basically, see here, whenever I have to check higher mental function of my patient, I want to check his judgment power. I want to check his abstract thinking. Abstract thinking. In this question, out of these 4 options, what is your answer? See here, I want to check either his judgment power or abstract thinking. What is the meaning of abstract thinking? Abstract. Whether a person is able to abstract the real meaning of something or not. I'm asking that, see here, I'm asking a proverb. I'm asking a proverb. Health is wealth. I'm asking my patient, what do you mean by health and wealth? What do you mean by health is wealth? So basically, this is a proverb. Now, I want to know whether my patient is able to understand the deeper meaning of health is wealth or not. It means I want to check his abstract thinking. Whenever there will be proverb testing, no, proverb, abstract thinking. But I'm giving a situation. What will you do if you see a house on fire? A clinician is, I'm asking my patient, what will you see what will you do if you see a house on fire? House on fire. And patient is saying that, sir, I will make a selfie. It means what? As per this situation, he is not able to take a decision. I want to check his what? Judgment power. Judgment power. So there are 3 judgment powers. See here. One is called the test judgment. As per this situation, house on fire, envelope on floor. So basically what? I'm going to test his judgment power. Social judgment. If I'm asking, how will you behave in graveyard? How will you behave in a marriage function? So basically, as per a social situation, if I'm asking, social judgment. If I'm asking my patient, what would you like to become in future? Doctor, engineer, pilot, or what? That is called the personal judgment. Personal judgment. So in this question, I wanted to check his judgment power. Basically, test judgment and as per the clinical scenario, as per the response of my patient, I can say that his test judgment is abnormal. Test judgment is abnormal. Easy to understand. See here, like if you are going to understand each and everything separately, then only you can answer a question of psychiatry in a right manner. Fine. Okay, fine. So basically, this is all about higher mental function. Most important is judgment related to examination. Second is abstract thinking. How do I check? How do I assess abstract thinking of my patient? One is called the proverb testing. Proverb testing. I'm giving a proverb, है ना, एक मुहावरा जैसा, है ना? So basically, if I ask my patient, what do you mean by a pen is mightier than the sword? God helps those who help themselves. Proverb testing. Similarities testing. I'm asking my patient, what is similarity between a table and chair? If he's saying that, yeah, both are on the floor, so it means what? His abstract thinking is abnormal. But if he's saying that, yes, both are made up of woods, yes, right. I want to check the attention power of my patient, attention level. For this, there is a test that is called as a digit span test. Digit span test. I'm asking my patient, see here, you count at the interval of 2, 4, 6, 8, and the 10, and the 12, 14, 16, 18. If he is able to count it, digit span test. Forward, going forward. I want to check the higher level of attention, that is called the concentration. Serial 7 subtraction test. I'm asking my patient, subtract 7 from 100. He has to count like 93, 86, 79, 72, right? 72, and after that 65, 58. If he is able to count at least 7 to 10 digits, it means his concentration power is normal. Overall, digit span forward test is very good. Next question. A 16-year-old girl is brought to psychiatry with the complaints of excessive exercising and dieting. On examination, she has parotitis, infection or inflammation over parotid gland, erosion over knuckles, bradycardia, dependent edema. She has a normal appetite but poor sexual development. What is the most probable diagnosis? See here, see overall, Dr. Shubham, very good. See, up to 7 questions, we have revised the general part of the psychiatry completely. Okay? So, ab batao, now we are in eating disorder. Eating disorder mein ek question pe we are going to revise all 4 disorders of eating disorder. What is your answer? Okay, fine. So most of you are saying what? Anorexia nervosa, most of you. Some of you are also saying bulimia nervosa. Please understand here how to differentiate. See, whenever I talk about anorexia nervosa or bulimia nervosa, anorexia or bulimia, both are, see here, in both condition, appetite is always normal. Appetite is always normal. But see, like in both condition, patient will be what? Very much image conscious. Image conscious. They would like to become what, like Deepika Padukone or Angelina Jolie, right? But do understand what is happening here. See here, when I talk about anorexia nervosa and bulimia nervosa, anorexia and bulimia nervosa. In anorexia nervosa, whenever a person will be having eating disorder, always remember, whenever a person is having eating disorder, image conscious. So first of all, they would like to stop eating. So mostly, see, this is most common among females, especially young and adolescent females, young females. So they don't want to eat at all. They will stop eating, or even if they have eaten a lot, after that, they will be having some kind of the purging episodes. They will induce vomiting. So whenever they are going to induce vomiting by inserting their fingers into the mouth like this, fine, no? So don't you think when fingers will be inserted into the mouth again and again, there can be inflammation or infection of the salivary glands? Yes. Insertion of hand. So like, don't you think there can be erosion over knuckles? Erosion over knuckles? Yes, it will be there. Fine. Erosion over knuckles is called as what? Russell signs. Russell signs. Russell signs. Russell sign is seen in both anorexia nervosa and bulimia nervosa, both Russell sign. Okay, fine. Now the question is that in anorexia nervosa, mostly it is restricting type. Basically, patient does not eat at all, mostly. Or maybe even once in a week, if patient is going to eat something, after that she will be inducing the vomiting, right? Mostly she does not eat, restricting type. So there will be situation like a starvation. Starvation means what? Lack of fat, lack of carbohydrate, lack of protein. Whenever there will be nutritional deficiency, do you think there will be weight loss? Yes, there will be weight loss. There will be what? Micro minerals deficiency also, right? No, there will be what? Weight loss, very, very important. Hormonal imbalance, very, very important. Protein deficiency, albumin deficiency, yes. So there can be dependent edema, yes. सब कुछ हो सकता है. Starvation है तो वो है ना. See, if there is situation like a starvation है, weight loss, hormonal problem, so many things will be there. So now, see, because of this, there will be menses problem also in anorexia nervosa. There will be lack of libido. Anorexia nervosa. See here, now there will be what? See, now there will be delay in secondary sexual growth. Delay in secondary sexual growth in anorexia nervosa. Do you think there will be dental caries? Yes. Fine. Easy to understand. Salivary gland inflammation? Yes. Now the question is, what about bulimia nervosa? Bulimia nervosa, appetite is completely normal. Every day she eats. Every day she eats normally. But after 2 hours, she is realizing, oh my God, I have eaten a lot. After that, she will induce vomiting. Every day she is eating. After 2-3 hours, she is realizing, no. So now you tell me, metabolism is already done. Digestion is already done. So there is no weight loss. There is no weight loss in bulimia nervosa. No weight loss. Energy is there, nutrition is there, hormonal, everything is normal. No weight loss, no menses problem, no sexual problem, no delay in secondary sexual growth. But frequently inserting the fingers in mouth, more dental caries, yes. More salivary gland inflammation, yes. More Russell signs, yes. Ab batao. Is there any confusion in differentiating anorexia nervosa and bulimia nervosa? Most important point you have to remember here is BMI, body mass index. Now, as per ICD-11, only weight loss. Earlier, weight loss and menses problem. Menses problem. These two were required to diagnose anorexia nervosa. But now, as per ICD-11, only weight loss more than enough to diagnose anorexia nervosa. So see here, poor sexual development, anorexia nervosa. चलो ठीक है, मुझे आंसर करो एक बार, क्योंकि ईटिंग डिसऑर्डर से you can anticipate one question. A 17-year-old female is there. She is image conscious. She is having fear of being fat. So now she is having Russell signs. है ना, Russell signs है. Okay, there is salivary gland inflammation there. Okay, fine. She is having One is Russell sign. Yes. Salivary gland inflammation. Yes. Menses are normal. So what is the diagnosis here? I'm saying menses are normal. What is the diagnosis? बुलिमिया नर्वोसा. बट इसी में अगर मैंने फोर्थ ऑप्शन डाल दिया, BMI is less than 18.5, BMI is less than 18. Now what is your answer? See here, more than 18.5, 18.5 to 24.9 is a normal BMI. Less than 18.5 is abnormal body mass index. Fine now? So it means weight loss is there. Now answer will be what? Anorexia nervosa. There should not be any confusion. But now see here, as per ICD-11, one new eating disorder is added in ICD-11. Please write this: avoidant restrictive food intake disorder. Avoidant restrictive food intake disorder. This is the new eating disorder which is added in ICD-11. Here also patient does not eat. Here also she is having weight loss. Here also she is having symptoms like starvation. But this is different from restrictive type of anorexia nervosa. She is not eating because she does not like the food. She does not eat because she does not like the taste or smell of food. She is not image conscious. She is completely normal. No problem in image consciousness. She does not eat because she does not like the taste or smell of food. That's why she is avoiding to have food. Fourth type of eating disorder, most common type, which is called as binge eating disorder. Binge eating disorder. Overall, this is the most common type of eating disorder, which is called as binge eating disorder. Foodie people, food lovers, Hannah, so they will be obese. They're not image conscious. So in eating disorder, we have learned 4 disorders. First of all, anorexia nervosa, then bulimia nervosa. After that, binge eating disorder, binge eating. And fourth, we have learned avoidant restrictive food intake disorder. 4 eating disorder. One questionnaire system which we are using for eating disorder, that is called as SCOFF questionnaire. SCOFF questionnaire. Okay. ये वन लाइनर क्वेश्चन में आ सकता है. ये बताओ अब नेक्स्ट, वेयर वी आर यूजिंग दिस क्वेश्चनायर सिस्टम. केज क्वेश्चनायर सिस्टम. वेयर? केज क्वेश्चनायर. केज. Alcoholism, right? Alcoholism. Cage questionnaire. Where do we use MChat questionnaire? MChat बताओ कहाँ पढ़ा था? Pediatric psychiatry somewhere. MChat questionnaire. MChat, where we have learned, see, these are your one-liner questions. MChat, we have learned in autism. Next question. A young female complains of horrible dreams. During the sleep, she suddenly gets up screaming and has symptoms of intense anxiety, such as tachycardia and sweating, but she is not able to recall the dream. What is your answer? Eating disorder over. Next is sleeping disorder. See, there are 2 types of horrible dreams. One is called as nightmare. Second is called as night terror. One is seen during REM phase, rapid eye movement. Second is seen in non-rapid eye movement. REM means remember. Non-rapid eye movement, not able to recall. So the dream which will be seen during a REM phase of sleep yes, you will be able to recall everything. The dream which you are going to watch during non-rapid eye movement, you will not be able to recall, not be able to recall. So night, so what is the other name of this one? This is also called as pavor nocturnus. This is also called as pavor nocturnus. Answer is B here. Do you understand? If a person is sleeping for 8 hours, 8 hours, fine now. So there will be what? 6.5 hour for non-rapid eye movement and 1.5 hour for, 6.5 for NREM. Second is REM. After every 90 minutes, after every 90 minutes of non-rapid eye movement, after every, see here, after every 90 minutes of non-rapid eye movement, REM will follow. So in one night, there will be 4 to 5 cycles. There will be 4 to 5 cycles of REM sleep. Okay, now fine. So remember, see, please understand what kind of question they can ask you, because I don't want to teach you in depth now, because this is a test and discussion only. I'm I'm explaining more actually. Fine now. So please understand that. See here, non-rapid eye movement, like whenever you are going to perform EEG, alpha wave, beta wave, or the delta wave. Right now, alpha means what? Awake, and delta means what? Say D for deep sleep, right? Fine. See here, so 4 phases, actually 4 phases of the non-rapid eye movement. So during NREM sleep disorder, see, during NREM sleep, there will be some disorders. One is called the pavor nocturnus, which is called as what? Night terror, right now? Fine. Horrible dreams, extreme level of horrible dreams, but he or she will not be able to recall anything. Sleepwalking, which is called as somnambulism. Sleep talking. If a person speaks during sleep, this is called as somniloquy. Teeth grinding during the sleep, bruxism. Passing out the urine during sleep, sleep-related enuresis. Now the question is that somnambulism, if a person is going to commit any crime during somnambulism, do you think he will be punishable or he will be punished? No punishment. Why? No punishment. Why? Because he is completely unconscious. He does not remember anything, because this happened during the deep sleep, NREM sleep. As per which rule? No punishment. As per IPC number. Which IPC? 84. IPC number 84, which is what? McNaughton's rule. So all these are related to sleeping disorder. Mostly these will be seen in the young age. Okay, in the young age, but okay, so how to treat? Mostly reassurance as per the age, like there will be improvement. Okay, no? McNaughton's rule, IPC number 84. So during NREM, all these you are going to see. During REM sleep, you can see narcolepsy and nightmare. If I ask you, see, in boys, there will be nocturnal penile erection or intumescence. Nocturnal. See here, now you tell me, see, penile erection will be seen in boys. So that will be seen during REM phase or non-REM phase. What is your answer? Penile erection. Always understand that rapid eye movement means what? REM phase. Rapid eye movement, REM phase. This is almost equal to situation like awake. Eyes are closed, but a person is awake. Okay, now what is happening here? So here, rate of metabolism will be high. Pulse rate, respiratory rate, blood pressure, everything will be higher. Penile erection, all these you are going to see higher during REM phase of sleep, right? Very good. Next question, very, very important sleep disorder, that is called the narcolepsy. Which of the following is wrong about narcolepsy? Okay, see, meaning of the narcolepsy, see, narcolepsy means what? excessive sleepiness in daytime, right? Okay, fine. This is a sleep disorder where a person is sleeping a lot. So this is a disorder of hypersomnia or insomnia. This is a disorder of hypersomnia. Okay. During narcolepsy, yes, there can be hypnopompic and hypnagogic hallucination. Yes. Please understand that 4 symptoms of narcolepsy, very, very important. There can be cataplexy. Cataplexy. What is the meaning of the cataplexy? Sudden loss of muscle tone. Patient was speaking to you. He was standing in front of you. He was standing and he was speaking to you, right? Suddenly he can fall because there can be sudden loss of muscle tone, right? And that is called what? Cataplexy. Sleep attacks. Anytime he can sleep, there will be irresistible urge for sleep. He will be talking to you and he will fall asleep. I know, like he will be talking to you and after that, see here, easily he can sleep. Anytime he can sleep, sleep attacks. Hypnopompic and hypnagogic hallucination. Okay, we have learned it. Sleep paralysis. Just after getting up in the morning, patient is not able to move his upper limb or lower limb. That is called as sleep paralysis. So now tell me, hallucinations can be seen? Yes. Patient can fall while standing. That is called a what? See, this is called as cataplexy or catalepsy. 2 important words here. One is called the cataplexy, which is seen in narcolepsy. One word is called the catalepsy. Catalepsy. This is a motor symptom which is seen in schizophrenia. Schizophrenia. So in sleep disorder, we see cataplexy. Cataplexy means what? See, there will be sudden loss of muscle tone and patient can even fall. So what is the drug of choice for the narcolepsy? Modafinil. Now, question is, why narcolepsy happens? As I have taught you that REM sleep and non-REM sleep. 2 types of sleep, rapid eye movement, non-rapid eye movement. If a person is sleeping for 8 hours, 6.5 hours, non-rapid, 1.5 rapid. At least there should be 90 minutes of sound sleep. After 90 minutes, like there should be repetition of REM. See, 90 to 100 minutes, normal time. But what is happening here? If after every 60 minutes, if a person is getting rapid eye movement, now there will be sleep disorder. So there will be reduced latency of REM. Which one is wrong? 4th. D is wrong here. There will be what? Reduced latency of REM sleep in narcolepsy. Narcolepsy. Narcolepsy is what? Sleep disorder. Next. Okay, next we are going to learn about personality disorders. Very, very important question. Minimum 1 question you can anticipate from personality disorders. A 19-year-old boy thinks that he is very special and very talented. He feels that he is extremely handsome. Whenever he travels, he expects that people should admire him. He asks his friend to praise him more in front of strangers so that they should pay more attention towards him. He fought with a stranger who told that he walks like a girl. And after that, he got severe anxiety. Right? Yeah, in this question, I can see that all of you are right. All of you are correct. Ye to dekh ke samajh mein aa raha hai. This is what? Narcissistic personality. Very good. Narcissistic personality disorder. See, remember, because personality disorder is very, very important. Just like small things which we are going to remember. See, As per DSM-5, see, personality disorders are divided into cluster A, cluster B, and cluster C. Okay, just a fast revision. Cluster A will be having schizoid, schizotypal, and the paranoid. We are going to see here cluster A. See, all personality disorders are extremely important. Please remember all these points. Cluster A, how many personality disorders are there? Paranoid, schizoid, schizotypal. Cluster B, histrionic, narcissistic, borderline, antisocial. Cluster C, avoidant, dependent, and OCD. How to remember all these? Please understand here. See a small picture and remember only a few points. Personality disorder of एक question पक्का आएगा, one question. Paranoid, if a person is always suspicious of others. हमेशा शक करना. Always suspicious, paranoid. Mistrust of other people. Believe in conspiracy theories. Shadyantra rachna, right? Very sensitive people, right? Schizoid, emotionally cold. You appreciate him or you criticize him, no problem at all. Like Einstein type. Okay, no? Fine, no? Emotionally cold, socially detached, living alone, solitary life. Sometimes they are less attracted to opposite sex. If I ask you to remember only 1 or 2 points related to schizoid personality, emotionally cold and socially detached. Bas, kafi hai. Schizotypal, more abnormality will be here. A person will behave in odd and inappropriate manner. Magical thinking. Odd and inappropriate behavior. Because of this, they will not be able to maintain any good relationship with other people. Sometimes they will be having psychosis also. So they have somewhat similar symptoms like schizophrenia. For a short period of time, there can be delusion and hallucination. Fine. So this is also called as on the borderline of normal people or schizophrenia patient. It is called a schizophrenia continuum. Cluster B, histrionic, full of drama, and the tantrums. Over, तो ये बताओ ये लोग में क्या हो गया? Over expression of emotion, attention seeking attitude, right? No, histrionic, narcissistic, self-love. Every time, I'm the best, I'm special, I'm most talented, everyone should appreciate me. But self-love is there. But in the narcissistic problem is that even if minor criticism will be there, no, he can easily go into depression. So whenever you are going to treat narcissistic people, no, you have to treat depression also. Third is antisocial, illegal activity, है ना? Illegal activities, right? है ना? Antisocial, against the society, like, है ना? जैसे मतलब कि stealing something or a murderer, है ना? Fine, no? So these are what? Antisocial, illegal activities. Dawood Ibrahim जैसा समझ लो, है ना? Antisocial type, right? Okay, fine. But antisocial type का मतलब क्या? यहाँ पे see here, which type of childhood history will be there? When he was a child, he was suffering from a disorder when he was always harming plants and animals. He was disobeying elders. He was not able to adjust with the elders. Conduct disorder, not ADHD. First, see here, conduct disorder. Mostly what? Conduct disorder. Higher risk of what? Antisocial personality disorder. Repeatedly asked question. Yes, after AD, see here, even after ADHD, yes, he will be having higher risk. But mostly what is happening here, if a person will be having what? Antisocial personality disorder, no? Dr. Navrak, acha. Okay, fine, theek hai. So antisocial. Now, what is the meaning of the borderline personality disorder? Borderline, frequent mood swings. Frequent mood swings. Why she is shouting on him, even he does not know, even she does not know. Frequent mood swings, always fighting with others, always fighting with others, anxious, frustrated without any reason, without any reason. So see, over distracts, sometimes there will be what? Slashing of wrist, overdoses of medicine. This is what? Borderline personality disorder. Borderline personality disorder. All these, please remember: histrionic, full of drama; narcissistic, self-love, I'm the best; antisocial, illegal activities; borderline, frequent mood swings, fighting, always fighting with others without any reason, right? Now, self-destructive act, they can go into depression. Easy to understand? Yes, Dr. Ajay? Yes, might be. Yes. Okay, fine. See, last time, last time there was a question in MCI that a person shown a knife to a female and after that he snatched her purse. Right now, which type of personality that man might be suffering from? Antisocial. Third, cluster C, avoidant. When a person will be having fear of rejection. If a man got, suppose if a man who got, right now, I think this was the next question, no? This question only. A 24-year-old man who got disqualified in multiple job interviews has developed fear of rejection. Whenever he meets any stranger, he starts stammering. He tries to stay away from gathering. His personality can be. Always remember that what will happen to a man who will be disqualified from 17 to 18 jobs? What will happen to a boy who proposed 17 to 18 girls and all of them has refused him? He will be having what? Fear of rejection. Because of this, they will avoid the gathering, avoid meeting people. Avoidant personality disorder, right? This is what? Avoidant personality disorder. Next is dependent. See, especially sisters, no? Younger sister is completely dependent on. Younger sister is completely dependent on elder sister. Seeking excessive amount of advices. Always, so every time dependent on others. Obsessive compulsive. Please understand that this OCD personality disorder and OCD of contamination. OCD of contamination was neurosis. That was ego dystonic. This OCD is ego syntonic. Here, OCD type of personality disorder, a person will show, always he will be showing what? Perfectionism. Like Mr. A.R. Rahman, Mr. Amir Khan. They take excess time to make a film or compose a music. So OCD type of personality disorder, can result into delay of result. So when you see this, what is your diagnosis? See, when you see this photo, I have already shown this photo in your classroom also. No, this is a type of what? Over exaggeration of emotion, over exaggeration of anything. This is a type of histrionic type, right? Histrionic hai, right? Okay, fine. Next question. See, this question is already okay, done. Next. Okay, chalo, personality disorders. See, overall, now you tell me, see here. Overall, all personality disorders are over cluster A, cluster B, cluster C. Now, there is one update in ICD-11, which you should know. ICD-11 में एक update है. Earlier we have divided what? Cluster A, cluster B, cluster C. Okay. Now ICD-11 is saying that there will be mild, moderate, and severe personality disorder. Okay, na mild, moderate, and severe. That's it. बस इतना ही और कुछ नहीं है. Okay, chalo. One more type of personality will be there. Type A, type B, type C, type D, and type H. Full of competition, type of A. Very ambitious, workaholic, full of competition. No competition, easygoing, relaxed, type B. Stressed, C. People who are always under stress. Type D, negative thoughts and depression, depressed people. H, hardiness, who wants to control other people, Now the question is, which type out of these 5 who are at the higher risk of development of heart attack? Coronary artery disease, always working, very ambitious, no time of relaxation, type A. Negative thoughts and always depressed, type A and D are at the higher risk of heart attack in future. Type B, easygoing, healthy people, mast mala. Type C, always under stress. Type H, hardiness, who wants to control other people. ये सब याद रख लेना, ठीक है? Personality disorders are over. Okay, related to personality disorders, please remember. Okay, one more point, that all personality disorders will develop in young age, adolescent age group. These are ego syntonic. Okay. Which type of personality disorders have suicidal tendency? They are at the risk of suicide. First of all, suicidal tendency में कौन सा है? Borderline personality disorder. है ना? हाथ काट लेना, slashing of wrist, right? Now overdoses of medicine. Even antisocial personality disorder, no, antisocial also, they are also at the risk of suicide. Okay, fine. Substance abuse will be seen in antisocial. So all these are important. Most of the personality disorders, how you are going to treat? Only psychotherapy. Somewhere where there can be psychosis, like the paranoid or the schizotypal. है ना? जरा एक बार रिवाइज करो तो एक बार. So first please write in the chat box how many personality disorders we have learned in cluster A. Please write, because this is extremely important. I'm telling you. In cluster A, how many personality disorders you have learned? Please write the name likho. Paranoid, schizoid, schizotypal. Okay, fine. Please write about cluster B. Histrionic, narcissistic, borderline, antisocial. Very good. What about cluster C? Avoidant, dependent, obsessive and compulsive. Okay, fine. Very good. See, they are asking in which type of personality disorder we have to use beta blocker drug like propranolol, beta blocker, so that you can decrease the blood pressure and aggression could be decreased in antisocial personality disorder, right? Antisocial. Very good, Dr. Sashi. Very good. Okay, next question, please. Okay, next. See, now here, a 45-year-old male has recently started writing books. Okay, recently, but no one is able to understand. The matter written in his book, as the words which he has used were never seen in any dictionary. Theme was disjoint. Nowadays, he has become very shy, self-absorbed. When he addresses people, he speaks about meta-philosophical ideas. Diagnosis, batao. What is the diagnosis? See, I am telling you, this question you can anticipate because this question has never asked in MCI exam before. But this was asked in AIMS exam. AIMS में ये question, AIMS and JIPMER 2 years before. You can anticipate similar question in June exam, 4th June में. अब बताओ आंसर. देखो, I'm not asking you a symptom, I'm asking you a disease. पूरा disease बताओ, पूरा देखो. See here. Decode the language. और दोबारा करते हैं, देखो. Very good. No one is able to understand. Never seen in any dictionary. Neologism. Okay. There was disjoint, means loosening of association. He has become very shy and self-absorbed. Negative symptoms are there, no? Negative symptoms. Metaphilosophical ideas. Flight of ideas or grandiosity. Whenever there will be more than 1 or 2 symptoms in one person, this is what? Schizophrenia. Schizophrenia. Diagnosis is schizophrenia. Easy to understand. इस तरह से क्वेश्चन बनेंगे अब. ठीक है? Fine. Answer was what? Schizophrenia. Schizophrenia. Next question here. Now let's talk about the pathophysiology of schizophrenia. A psychotic patient says that whenever he looks at the tube light, he starts hearing the voices of God. First of all, you tell me. No issue, Dr. Lavanya, no issues at all. Now you tell me, what does it mean? When he looks at the tube light, he starts hearing the voices of God. This is synesthesia or functional. Synesthesia is also called as reflex, right now? Stimulus in one modality, hallucination in another. This is synesthesia. Synesthesia, right? Okay. Fine. तो ये तो हो गया इसको hallucination. Okay, fine. And sometimes he feels that everyone will go back to the God and there won't be a single person on the earth. Which type of delusion is this? Which type of delusion is this? Everyone will die. Everyone will go to the God. Basically, nihilistic delusion, right? Nihilistic delusion of negation. See here. As we have learned in schizophrenia that there will be 2 types of symptoms in schizophrenia. There will be 2 types of symptoms. One is called as positive symptoms. Second is called as negative symptoms. Okay, no? So what is the meaning of the positive symptoms? Whenever a person is having delusion and hallucination, delusion and hallucination, he is having what? Positive symptoms. Why do we call it positive symptoms? Because he will respond well to medication. Good prognosis, good prognosis. I gave you the example of Professor Nash during my lecture, right? Professor Nash had delusion and hallucination. Good prognosis. He was a Nobel Prize winner, right? Good prognosis, positive symptoms. But if a person is having negative symptoms like anhedonia, what is the meaning of anhedonia? Inability to experience pleasure. Okay, no, anhedonia, alogia, right? No, alogia, aphasia, avolition, all these are negative symptoms. Why? Because bad response to medications, bad prognosis, bad prognosis. 2 types of symptoms, positive symptoms, negative symptoms. Now, what is the pathophysiology? Now, can you answer me? How many dopaminergic tracts are there in our brain? Can you answer me? 4 का नाम बताओ, नाम तो बताओ. There are 4 dopaminergic pathways. One is called as mesolimbic tract, mesolimbic. Second is mesocortical tract, cortical, okay. Third is nigrostriatal. Fourth क्या था बताओ? Tiburoinfundibulum. Tiburoinfundibulum. सिंपल सा रूल है, याद रखना हमेशा. See here, in our limbic system, increase of dopamine, serotonin, and norepinephrine will cause psychotic symptoms. Increase of dopamine, psychotic. Decrease of dopamine, depression. So in schizophrenia, earlier, like it was said that only increase of dopamine will cause what? Psychosis, like delusion and hallucination. Remember here, one point related to mesolimbic and mesocortical tract. Increase of dopamine in mesolimbic tract will cause positive symptoms. Decrease of dopamine in mesocortical tract will cause negative symptoms. Keep this in your mind. Extremely important theory. Extremely important. Increase of dopamine in mesolimbic tract will cause positive symptoms. Decrease of dopamine in mesocortical tract will cause what? Negative symptoms. But okay, बात खत्म. तो अब बताओ क्या है यहाँ पे आंसर? Basically, in this clinical scenario, patient is suffering from delusion and hallucination, which are actually positive symptoms. Positive symptoms का मतलब क्या होगा बताओ? Now you answer me, please. Increase of dopamine in mesolimbic tract. Mesolimbic tract. Easy to answer? Fine. No? But if I ask you, if a person is, okay, suppose if a person is getting very aggressive, he is antisocial, he is having anhedonia, he does not speak anything, basically he is having negative thoughts. So out of all these ABCD, what will be the answer? Batao kya hoga answer? Answer will be D then, decrease of dopamine in mesocortical tract, right now? Okay, fine. Now, if I ask you, out of these four options, which one will be having better prognosis? ABCD, batao. ABCD. Which one will be having better prognosis? A. Easy to understand. Out of these ABCD, which one will be having bad prognosis? Can you answer me this one? D. Okay, fine. Now, if I ask you, out of these ABCD, which one will respond well to medications? Can you answer me? A. Which one will... Okay, fine. Which will not be responding to medications? D. Okay, baat khatam. If you can understand this logic, ho gaya sab khatam. Everything is fine. You can solve all the questions, right? Chalo, fine. So this was related to pathophysiology of schizophrenia. Increase of dopamine will cause psychosis. Decrease will cause what? Depression. Easy to understand. Fine. No? And especially if I talk about mesolimbic and mesocortical, increase in mesolimbic positive. That's it. Decrease in mesocortical negative. Next question. A known case of schizophrenia complains that he could hear many voices abusing him. He's saying that one person is saying that he looks ugly. One is saying that he looks fat. He looks like a donkey. Okay, he looks like a donkey here. Fine. I really get annoyed by these voices. These are considered as what? Okay, fine. Chalo, theek hai. Answer karo pehle. Most of you are wrong. I can see that most of you are wrong. Dr. Shashi Murugan, Dr. Ram, very good. Dr. Daniel, very good. Chalo, theek hai. Okay. Okay, first of all, chalo kuch one-liner likh lo, kuch one-liner points. Who coined the term schizophrenia? Who coined the term schizophrenia? Eugen Bleuler. Eugen Bleuler. Right now? Eugen Bleuler. Bleuler. Okay. Fine. Who gave first rank symptoms? Who gave first rank symptoms of schizophrenia? Kurt Schneider, right? Schneider. Okay, fine. Chalo, theek hai. Now we are going to learn about, see here, these are what? So overall, when you see this question, like this will be, situation will be something like this. Okay, no? Now see, overall, basically, this is about first rank symptoms of Schneiderian. Okay, now Kurt Schneider. He said that there can be 11 symptoms in a patient of schizophrenia. How to remember? Very easy. See, there will be 3 auditory hallucination, there will be 3 made phenomena, and there will be 3 thought phenomena. Easy to understand. See here, there will be 3 auditory hallucination means what? See here, audible thoughts, voices commenting on one's action, voices heard arguing. These are auditory hallucination. Please understand that overall, most common type of hallucination is auditory hallucination. Auditory hallucination. Audible thoughts means what? Whatever patient is thinking, he will hear it. He will hear it. Suppose if he is thinking that I think I should go on lunch date. Okay. So whenever he is going to think like that, after that he will listen. Oh, he's going for lunch. Okay, fine. Okay, suppose if he's thinking that I think I should sleep. Oh, he's going to sleep now. So whatever he is thinking, he will hear it. It is called as audible thoughts, also called as thought echo. Also called as thought echo. Voices commenting on one's action. Whatever he will be doing, he will hear the voices of Navjot Singh Sidhu, Sidhu Saab, right? Suppose if he's getting ready for his office, he is staying on 15th floor and that building is 50-floor building. Okay, fine. Now suppose if he's getting ready for his office, whatever he is doing, he will hear the commentary. Whenever he's getting ready, see, he will hear the commentary. Oh, he's wearing the shoes. Okay, now he's going to wear the shirt. Now he's going to wear the tie. After that, he's going to wear the wristwatch. Now he's going to pick his bag. Now he's going to lock his door. Now he's going to move towards the lift. Okay, fine. Now he is entering into the lift. Now he's going to press the ground floor. Since morning to night time, he is hearing the comments, commentary. At one time, he will start obeying the command. Now he will hear, hey, why you are going to ground floor? Press 50th floor, 50th. Now he will start obeying the command. He will press 50th floor. Now let's go up. Okay, now go out. Now he is on the 50th floor. Now, why you are going to ground floor? See, you wanted to stay with those creepy people. Okay, now look at down. These are, okay, these people, they look like insect, very, very small people. You are a Spider-Man. You are Batman. You are not supposed to stay on the ground. You should stay in the sky. Let's fly in the sky. After that, he will fly. He will obey the command. He will fly. He will jump. After that, suicide. Most dangerous type of hallucination is auditory, and that is what? Commentary type of hallucination. Voices heard arguing. Okay, now voices heard arguing. Suppose if patient is sitting here and a patient is sitting here. Okay, fine. Now he will hear that one person, okay, he will say that, okay, like he will hear that how ugly he is, how fat he is, how bad he is. He will hear the voices. So these are what? Voices arguing. Who is he here? He is patient. Now you tell me this is called as third person hallucination. When I talk in the English like me, I or me, first person, you, second person, he, she, it, they, third person. This is also called as third person hallucination. Third person hallucination. So this is what here? See here now. He is hearing some voices. This is called a what? Voices arguing. Voices arguing. Voices arguing. So there will be 3 auditory hallucination. There will be 3 made phenomena. Made phenomena. Made affect, made volition, made impulse. So whatever he will be doing, patient will say that someone else is making him to do. Someone else is making him to do. So before understanding the made phenomena, let's understand the thought phenomena. After that, I will explain you this part. Okay, this part is extremely important. That's why I'm explaining it. Okay, Chalo, fine. One is called a thought insertion, thought withdrawal, and thought broadcast. Patient will say that someone is inserting a thought in my mind. Patient will sit on the bed and suddenly he will get up. He will put his hand in the running fan. After that, if you ask him, why did you do like that? No, I did not do it myself. Someone else, that guy who is sitting over there, he has inserted this thought in my mind. Thought insertion. Thought withdrawal, patient will say that someone can withdraw my thoughts. And the thought broadcast, oh my God, whatever I'm thinking, this is being broadcasted. Everyone is knowing about thought. Now, actions will be made affect. Affect means what? Emotion. Affect means emotion. Emotion. Fine. See here, suddenly a person who is sitting in the hospital bed. Fine now? Okay, fine. See here, now patient suddenly now at one time she is laughing, at one time she is crying. When nurse is asking, why do you do like that? No. She can control my emotion. Okay, she has a remote of my emotion. Whenever she wants, she can make me laugh. She can make me cry. Made affect. Made means what? See here, I made you to hit him. I made you to do like it. Basically, I'm talking about action. Made volition against my own will. Against my own will. I was sitting in an OPD. I was sitting with a child and there was a parent, right? Okay, there was a parent also. Fine. Okay. See, like in the beginning, I was playing with the child and after that, suddenly I slapped him. Fine. After that, when parent asked, why did you slap my child? I was saying, no. He made me to slap. Okay, someone else is controlling my action. I don't know who is that person, but whenever he wants, he can make me to do anything. This is made volition. Made impulse. Impulse, urge. A patient who was drinking juice, suddenly when nurse came, he thrown the glass of juice. Okay, so, he thrown the juice on the nurse. After that, when she complained, when she shouted, patient said that, no, I had that kind of impulse, that kind of urge that I was supposed to throw it. Fine, this is what? Made impulse. Somatic passivity. Patient will claim that aliens can send some radiations. Patient is saying that I'm having abdominal pain because of the radiation, and these radiations are sent by the aliens. Visceral hallucination is called as somatic passivity. Visceral hallucination. Visceral hallucination. Somatic passivity. Delusional perception. With a normal perception, one delusion will be associated. Patient will say that, sir, whenever I look at the phone, after that I'm getting this information, oh my God, I am a gay. Oh my God, I am a gay. With a normal perception, one delusion will be associated. Delusional perception. So please understand that whatever delusion will be there in schizophrenia, that will be considered as the primary delusion. Delusion can also be seen in depression or bipolar disorder. Okay, some other disorders also. Apart from schizophrenia, association of delusion, that kind of delusion will always be considered as secondary delusion, right? Okay, chalo, fine. See, one more point here related to, see, even Eugene Bleuler, he described symptoms of schizophrenia with the help of 4 A's. He said that a schizophrenia patient can have autism. Autism means what? Inability to make friends, poor eye contact, lack of social smile. Ambivalence, inability to take a decision. I should go to right or left. Patient of schizophrenia will be standing on the road, he will be standing on the road for half an hour. He will not be able to decide, okay, whether to go to right or left. Affect disturbances. Emotional means depression, anhedonia, or euphoria. Anything can happen. Association disturbances. loosening of association, like formal thought disorder. Sometimes they can frame a question like this: which of the following does not belong to the symptom of Bleuler's? Autism, ambivalence, affect, and aggression. Fine. A for aggression, you can rule out. Okay, fine. So now you can take a small break. Okay, come back soon. After that, we are going to start from 16th question. Okay. See, question number 16. See, Mr. Richard, a known case of the paranoid schizophrenia. He talks about omni micro. See, this question was asked in JIPMER and NEET PG also. He talks about omni micro, but he is unable to explain it in detail. And he's not able to reach a conclusion. He often repeats last syllable, a last word of last sentence. This can be related to what? Fine. Now, I hope this is a very easy question for you, right? Please answer me. See, you know, like he coined a new word. No, he coined a new word, omni micro. Omni micro, neologism. Out of these four options, when he coined a new word, which he is not able to explain, that is what? Neologism. But the question is that, see here, there is one more word that is called the logoclonia. Here, a patient will be here, last syllable of last word will be repeated. Suppose if you ask, which day is today? Suppose the patient is saying Sunday, a. This is what? Logoclonia. Out of these four, when specifically if it is asked for omni micro, this is what? Neologism. Answer is C. Next, a young man is brought to hospital with history of behavioral changes recently. He is occasional alcoholic person. Sometimes he drinks. Okay, fine. Family members are complaining that he gets very suspicious of other people these days. He thinks people are trying to conspire against him. So basically, this is a type of delusion of the persecution, right? Delusion of persecution. Someone wants to harm me. They conspire against me. Though his father says that there is no reason for his fears. Everything is fine, but he thinks like that, right? Patient also reports of hearing some voices which comment on his action. Commentary type of hallucination. Basically, there is delusion and hallucination. Patient is suffering from schizophrenia, right? Patient is suffering from schizophrenia. More than one or two symptoms, patient is suffering from what? Schizophrenia. Next, a patient with schizophrenia was admitted in psychiatry ward. When the nurse entered the room, this question we already have discussed during the class. Okay, now he started beating the nurse. When the nurse entered the room, he started beating the nurse and accused that actually this nurse is his real wife, and accuses her of giving him wrong medication. What is the diagnosis? If you can solve this, it means you are on the right track. Because please understand that this is a really extremely important question I'm telling you. This is Capgras syndrome or Frigoli syndrome. See, one is called as the Chalo, take. I can see your answer. And 50% of you are right and 50% wrong. See, one is called the Capgras syndrome. When a person is, see here, how to differentiate this one. See here, patient believes that a familiar person is replaced by someone else. one person is replaced by someone else. Who thinks, suppose the husband is saying that my wife is replaced by someone else. She looks exactly similar to my wife, but she's not my wife. Means one person is changed by another person. That is called the Capgras syndrome. Frigoli syndrome, where person is same, but the patient is claiming that my own brother, he can change multiple appearances. He can change multiple appearances. He can change multiple appearances and he can disguise me as a stranger. So Frigoli syndrome means what? Frigoli syndrome means what? A familiar person can change multiple appearances. So whenever you see multiple masks, no? See, when I'm saying A is replaced by B, this is called the Capgras. How to remember? In a football ground, natural grass was replaced by artificial grass, which is called as Capgras. Okay. But what about A is replaced by A1, A2, A3? Similar person. That is called the Frigoli syndrome. Frigoli syndrome. See, now you tell me here, patient is saying that she's not the nurse. My wife is, she behaves that she is a nurse only. She is the same person who changes different appearances. This is Frigoli syndrome. This question was asked in AIMS. Don't forget this question. Okay, no? Fine. Syndrome of subjective double means, see, syndrome of subjective double means what? If I am thinking that I am having multiple double roles, one Dr. Nadeem is in India, one is in China, one is in Russia, one is in America. I am having multiple double roles. That is called as syndrome of subjective double. Capgras syndrome is also called as delusion of double. Delusion of double. Capgras syndrome. Right? Next. Now see here, a patient is presented to casualty with an episode characterized by tongue protrusion, deviation of eyeballs, stiffness and abnormal posture of limb and the trunk without loss of consciousness for last 15 minutes. On history taking, he is a patient of acute psychosis who was on haloperidol, 20 milligram per day for last 3 days. His symptoms improved within a few minutes after administration of diphenhydramine hydrochloric acid. What is the most probable diagnosis as per his symptoms? क्या है आंसर बताओ? ABCD. So you always understand that haloperidol, no, haloperidol. Haloperidol, which is first generation drug, which is actually first generation drug, which is a type of the typical antipsychotic drug, right? Typical antipsychotic drugs, which is having so many side effects, and these side effects are called as what? Extrapyramidal side effects. Extrapyramidal side effects. And extrapyramidal side effects. Please understand that sudden muscle contraction after the injection of haloperidol, sudden muscle contraction after the injection of typical antipsychotic, that is called as dystonia. Dystonia. Okay, now sudden muscle contraction like what? Say a deviation of eyeball, right? No, like a stiffness, there will be tongue protrusion, dystonia. Okay, acute dystonia. Second, after injection of haloperidol, if a person is not able to sit at a place, if he is having restlessness, that is called as acute akathisia. Akathisia. Okay, fine. How to treat these two? Because these two are here. How to treat these two? Akathisia, restlessness is there. Okay, fine. Akathisia, restlessness is there. Drug of choice will be beta blocker, like propranolol. Propranolol. Dystonia, acute dystonia. Anticholinergic drugs, anticholinergic drug, central anticholinergic drugs. drug of choice. Fine now? So in this question, see here, so answer will be what? Acute dystonia, right now? Acute dystonia. Fine. But after injection of haloperidol, after injection of the first line drug, like the first generation drug, if patient is having severe body pain and high fever, if you do blood investigation, there will be increased level of CPK enzyme, which will be elevated whenever there will be muscle cell injury. That is called as neuroleptic malignant syndrome. High fever and body pain, CPK enzyme elevated, neuroleptic malignant syndrome. Muscle contraction, dystonia. Restlessness, akathisia. Neuroleptic, how to treat? Dantrolene is the drug of choice. Dantrolene. Related to side effect, they can ask you one question. Okay, no? Related to side effects, they can ask you one question. Next question. See here. A 23-year-old unmarried female gets delusion and hallucination. Haloperidol is prescribed to her. After that, she's complaining of restlessness, inability to sit at a place. So first of all, you tell me this is called as acute dystonia or acute akathisia. Acute dystonia or acute akathisia. What is your answer? Yes, this is called as what? Acute akathisia. Acute akathisia. Fine. Very good. Now, how to solve this question related to dopaminergic tract? Okay, now related to dopaminergic tract. See, yes, so now it will see there are 4 dopaminergic tracts. One is called the mesolimbic, mesocortical, nigrostriatal, and tuberoinfundibulum pathway. Now you tell me increase. See here, how to solve this question. I am having 4 patients. And first of all, like suppose if there will be a normal person, no? If there will be a normal person, in all dopaminergic tracts, dopamine level will be normal, 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 and normal. See, this table is very, very important, so don't forget it. Okay, now? Earlier, scientists were thinking that only because of dopamine, only because of dopamine, a patient is having all these symptoms right now. So they were not thinking about serotonin. No. Fine. So whenever there will be schizophrenia, now you tell me, see, in mesolimbic tract, it will be increased. In mesocortical, it will be decreased. Here, not affected, not affected. So when I talk about schizophrenia related to dopamine, what is happening here? See, here it will be increased, here it will be decreased. So here patient will be having all the positive symptoms, here negative symptoms. Okay, fine. Now, since scientists were thinking that only because of dopamine, so they made a drug that was typically antagonizing D2 receptors. So D2 antagonist. So when I am going to give, okay, D2 antagonist like haloperidol. Since this was the first time, so this was actually what? First generation antipsychotic. Typically blocking dopamine antagonist. So this was what? Typical antipsychotic drugs. So now you tell me, whenever I'm giving haloperidol or first generation drug, first generation or typical antipsychotic drug. So now you tell me, whenever I'm giving antagonist of dopamine receptor, after that dopamine level will be decreased in all the tracts now, because we are giving dopamine antagonist externally. Mesolimbic decreased, mesocortical decreased, here also decreased, here also decreased. Easy to understand. See here, now you tell me what will be the situation now. See here, see in mesolimbic tract, dopamine got decreased. In mesolimbic tract, dopamine got decreased. So because of this, okay, fine. Delusion and hallucination will be improved for sure. But what about mesocortical tract? Here it is going to decrease. Now further it is going to decrease. Now there will be more and more negative symptoms. No, now there will be what? More and more negative symptoms. Now negative symptoms will be worst. What about nigrostriatal pathway? Please understand that nigrostriatal pathway, this is responsible for your motor symptoms. Hai? Motor symptoms means you can perform a behavior, you can perform an action. So now what is happening here, whenever there will be decreased level of dopamine in the nigrostriatal pathway, no, after that what is happening here, patient is having more symptoms like extrapyramidal symptoms. He is not able to sit at a place, pacing around, fidgeting the legs. Extrapyramidal symptoms are there because of decrease of dopamine in which tract? Nigrostriatal pathway. Nigrostriatal pathway. What is happening in this question now? Restlessness, inability to sit. So these are actually what? This is acute akathisia, which is a type of what? Extrapyramidal symptom. There will be decrease of dopamine in which tract now? Can you answer me? Nigrostriatal pathway. Easy to understand. Nigrostriatal pathway. Very good. Next. See here, what about tiburoinfundibulum pathway? See, apart from dopamine, this is having one more hormone that is called as prolactin. Prolactin in tiburoinfundibulum tract. So now you tell me dopamine and prolactin, these are antagonists of each other. If dopamine will decrease, prolactin will increase. If dopamine will increase, prolactin will decrease. है ना, दोनों opposite जाएगा. Right now, so now you tell me in tiburoinfundibulum pathway, when dopamine got decreased, now you tell me what will happen to prolactin? Yes, this will increase for sure. This will increase for sure. Easy to understand. If I hope you remember prolactin, oxytocin related to milk ejection and secretion, right? Question is that a 19-year unmarried female is there who is on haloperidol. She is complaining of galactorrhea. Galactorrhea. Or lack of libido. Impotency. That will be because of decrease of dopamine in which tract? Tiburoinfundibulum pathway. Tiburoinfundibulum pathway. If this table up to this much, if you are able to understand, you can solve all the questions related to dopamine, related to typical antipsychotic drug, related to typical antipsychotic drug. I hope this is clear to all of you, right? Chalo, fine. Now the question is that, so see, when we were giving first generation drugs, now at that time patient was having, see here, only positive symptoms were improving. Now the question is, what kind of question they will ask you? After giving haloperidol, only positive symptoms will improve or a negative will also be improving? Only positive symptoms will improve. Only positive. Fine. Patient is having more negative symptoms because of decrease of dopamine in which tract? Mesocortical tract. Patient is having extrapyramidal symptoms because of decrease of dopamine in which tract? Nigrostriatal pathway. Patient is having galactorrhea, gynecomastia, lack of libido because of decrease of dopamine in which tract? Tiburoinfundibulum. Tiburoinfundibulum. Easy to understand? Fine. Now, how to treat? See, there was a patient of LSD abuse in the hospital. There was a patient of LSD abuse. Do understand that how many substances can cause symptoms like schizophrenia? First of all, LSD, cannabis, alcohol, cocaine, hallucinogens. Right now, all these substances can cause symptoms like schizophrenia. So there was a patient in hospital. He was having psychosis because of LSD abuse. Now in the urine of that patient, there was increased level of metabolite of serotonin. So here scientists, they made hypothesis that yes, if a patient is having schizophrenia, there will be what? Deficiency of serotonin also. There will be deficiency of serotonin also. Fine. So now they, so now they made what? One drug which was blocking D2 receptor, and that was blocking serotonin receptor also. Since this was second time, no, so this is called, so this was called a second generation drug, second generation drugs. Atypical antipsychotics, atypical antipsychotics. Plus point was that, plus point, this was a D2 blocker, D2 antagonist, serotonin antagonist. One plus point was there. It was partial agonist over dopamine receptor, partial agonist. Because of this, now its main function was there to neutralize dopamine, to make it neutral. So now we have given what? Second generation drug. Now we are giving what? Second generation drugs. Second generation drug like clozapine, second generation drug like aripiprazole, clozapine, right now. So now when I'm giving what? Clozapine or olanzapine or risperidone, right? So now what is happening here? This is going to neutralize dopamine here, normal, here also normal, here also. Now what is happening here? So either this will become normal or increase, normal or decrease. So basically, now when I'm giving clozapine, now its main function is to normalize the dopamine. So now when I'm giving clozapine or atypical antipsychotic drugs, no, now there will be improvement in the positive symptoms also, negative symptoms also. No effect here in nigrostriatal and in the tuberoinfundibular. So please understand that right now, drug of choice for schizophrenia is what? Atypical antipsychotic, atypical antipsychotic, atypical antipsychotic drugs. Next question. A schizophrenic patient is making a posture in the ward. This is a type of what? Yeah, see, please understand that. See, like in the schizophrenia, motor symptoms can be there, right? Now, motor symptoms can be there. I know, because of multiple motor symptoms. See here, so these are called the catatonic symptoms, catatonia. Catatonic symptoms are what? Motor symptoms, physical symptoms seen in schizophrenia, Okay, fine. What are the motor symptoms? See, this can be your question. They can ask you which of the following is not a catatonic symptom of schizophrenia. Stupor, immobile. Stupor means what? Immobile. Means he will stand at a place, after that he will not move. Waxy flexibility, flexibility like wax. If he is keeping his hand like this, after that, if you are asking him, please put your hands down, he will not put it down. So after that, if you are going to push up, maybe if he's going to do like this, it will be like this. Like a waxy flexibility. Catalepsy. You were doing physical examination, you ask the patient, abduct your shoulder like this. After that, there will be neurogenic block. He will be standing like this for half an hour, for 1 hour. This is called as catalepsy. Posturing, making a different type of posture for the longer time. Very good. Hyperactivity, sometimes a patient of schizophrenia he will become what? Hyperactive, excited. Sometimes automatic obedience, whatever you ask him, he will obey you. Sometimes negativism will be there. Whatever examiner is speaking, he will mimic it. Echolalia. Whatever examiner is doing, he will also repeat the same thing, mimicking examiner's movement. Echopraxia. Making odd facial expression like this. Grimacing. Grimacing means what? Making odd facial expression. Stereotypy and mannerism. These two are important things. Odd and purpose. See, these both movements are odd only, 100% odd, but one is purposeless. Sitting in front of you doing like this, purposeless, but every time saluting everyone. Purposeful. Odd but purposeful is good manner, mannerisms. Ambitendency, inability to take a decision. Gegenhalten, Gegen-Halten movement, resistance to passive movement, resistance to passive movement. So basically, if patient is sitting like this, you are asking, put your hand down. He is not putting it down. If you are going to push him, he will also push you. He will resist you. This is Gegen-Halten. Perseveration, unnecessary repetition of same thing. These are what? Motor movements. Now you tell me, what is the answer here? Making a posture for the longer time. Answer is posturing. Which type of schizophrenia has worst prognosis? See, there are 6 types of schizophrenia. So out of this, what is your answer? Yes, answer is what? Simple schizophrenia, right? Simple schizophrenia. Simple schizophrenia, not hebephrenic. See, please understand that paranoid schizophrenia. Overall, this is the most common type. Late onset and good prognosis. And what is happening here? Patient will be well groomed. Patient will be well groomed. Well groomed. Personality is preserved. Delusion and hallucination. So this will be having what? Good prognosis. I'm saying what? Late onset and good prognosis, like Dr. Nash. Catatonic schizophrenia. Motor symptoms are there. Best prognosis. Hebephrenic or disorganized. Mostly negative symptoms will be there. See, this is having early onset and bad prognosis. This is not having worst prognosis, but yes, there will be severe deterioration of personality, or you can say worst type of personality is seen in hebephrenic. If a person who is running naked on the road, he is abusing, he's playing with his tools, he has not taken bath for last 1 month, right? That is hebephrenic. Prognosis is bad. I'm not saying worst. Personality is worst. Undifferentiated, any type of schizophrenia which does not come under paranoid, catatonic, or hebephrenic, that will be called as undifferentiated. Simple, no positive symptoms. There was there was no history of positive symptoms, only negative. Simply it is schizophrenia. This is having worst prognosis. In some books, wrongly it is written that hebephrenic has worst prognosis. Simple schizophrenia has worst prognosis. Residual, see, started with the positive symptoms, left with some negative symptoms. Residue of schizophrenia. Next question. A 26-year-old female was brought to psychiatry OPD. See here, schizophrenia chapter is over. Most of the questions, please understand that most of the questions they are going to frame how to diagnose schizophrenia. More than 1 or 2 symptoms will be there. If you do not know the exact answer in the exam, I would suggest you to mark schizophrenia. Okay, this is this much common. 1 question from schizophrenia will come for sure. What kind of question they are framing? First of all, types of schizophrenia, pathophysiology of schizophrenia. Okay, no, sir. And after that, what are the symptoms seen in schizophrenia and related to antipsychotic drugs? Next question. You are asking related to 22. Huh? In question number 2, worst prognosis is seen in simple schizophrenia. Okay? Okay, ये question बताओ. चलो, question number 23, please. A 26-year-old female was brought to psychiatry OPD. She appeared to be agitated and claimed that her husband has a stolen baby from her womb. She did not sleep for last 4 days, and she was also muttering to herself. She had delivered a healthy female child 3 weeks back, however, was not taking care of her baby. Symptoms started in 2nd week after delivery. What is the likely diagnosis? चलो, here you are having some confusion. Okay, fine. चलो ठीक है, कोई बात नहीं. Very good, very good, very good. Postpartum psychosis you are saying. Chalo, we can discuss this. Please understand that. See here. Related to depression, you are not going to make any mistake. I'm telling you. Related to depression, very, very important. Related to postpartum depression, just after the delivery, within a few days, within 4 to 5 days, or within 3 to 5 days, a mother will be very, very sad. A mother will be very, very sad here. ठीक है ना? See, that is called a postpartum blues. Postpartum blues. But depression is very, very severe. Postpartum blues can be seen in 75%. 75% mothers. So there will be only, only sadness, or sometimes there will be tearfulness, that's it. But this will occur within 3 to 5 days after delivery. But there will not be thought of harming baby, no suicidal thoughts, no any history of mood disorder, no family history of mood disorder. Means what? Depression or mania. Feeling of guilt? No. But depression, postpartum depression is very, very serious. There will be anhedonia, tearfulness, sadness, thought of harming baby, yes. Suicidal thoughts, yes. Family history of depression, yes. In the future, it can develop, yes. So postpartum blues, only emotional support to mother. Postpartum depression, medicine plus psychotherapy, both will be needed. Symptoms like depression along with delusion and hallucination will be called as postpartum psychosis. Postpartum psychosis. Now, how to remember? Remember, BPD, bipolar disorder, borderline personality disorder, whatever. So basically, this is postpartum blues, postpartum psychosis, postpartum depression. It will occur within up to 3 days. This will occur within 3 weeks. This will occur within 3 months. This is most important. If you can remember the duration, easy to solve, no? Easy to solve now. Bolo? Days, weeks, months. अब इसमें बताओ, as per the question, कब हुआ स्टार्ट? देखो, सेकेंड वीक में स्टार्ट हुआ था. प्लस her husband, she is claiming that her husband has stolen the baby from womb. Easy to understand, no? Fine. Nihilistic delusion type, right? No. So this is what? Postpartum psychosis. Psychosis. Remember duration, 3 days, 3 weeks, 3 months. Months agar hai to depression. Depression. Easy to understand. I hope this is clear to all of you. चलो आगे बढ़ते हैं. See, this is extremely important question. I'm telling you, postpartum depression, postpartum blues, and postpartum psychosis. You are not going to forget. Okay. चलो. Next. Very good. अब बताओ, an elderly male is brought to hospital by his wife. He thinks that he has committed sins throughout his life. He is very much depressed and has suicidal tendency. He takes session with the spiritual guru too. He doesn't get convinced when his wife tells him that he has led a pious life. Pious matlab pure, hai na? Pak saaf life. What should be the best treatment modality for him? He is having depression plus delusion of guilt. Delusion of guilt and suicidal. Overall, देखो क्या है? Depression है, suicidal tendency. So antidepressant should be given for sure. But delusion of guilt is there, no? Delusion of guilt. Fine, no? So if there will be delusion and hallucination, do remember delusion and hallucination. These two are psychotic symptoms. Psychotic symptoms. So what you are going to do here? अब बताओ क्या decide करोगे? Right? So you have to give what? Antidepressant plus antipsychotics. Answer is C. Very good. Easy to understand now. Next question. A 23-year-old female who got divorced 6 months back. She has intense sadness, avolition, and anhedonia. She sleeps at least for 10 to 12 hours every day and gaining weight. She feels good and smiles whenever there is any celebration at home. क्या है आंसर बताओ? Some of you are marking typical depression. अच्छा जी. Cyclothymia you are saying? Okay. But most of you are saying this is atypical depression, right? चलो ठीक है, इसको समझ लेते हैं. I will say that there are two types of delusion. One is called the typical. There are the two types of depression. First of all, we are going to discuss typical and atypical. See, whenever there will be depression, what will happen typically? First of all, there will see, like if a person is not speaking, not sleeping, not eating anything, typical. Insomnia, not eating anything, weight loss. See what is happening here. Insomnia, weight loss, means not eating anything. So what? Anorexia, right now. So these are the typical signs. But a type of depression where biological symptoms will be reversed. He's sleeping a lot, eating a lot. Because of that, he is getting what? Weight. Hyperphagia, hypersomnia, obesity, sleeping a lot, eating a lot. This is atypical depression. Atypical depression. Easy to understand? Atypical depression. We have learned it. Reverse. But some more symptoms are there related to atypical depression. There will be what? Interpersonal sensitivity. Feeling of being rejected. Presence of mood reactivity. If something good will happen in the family, person will feel happy. Person will feel happy. See, in this question, what I have taught you, she feels good and smiles whenever there will be any celebration, right? Whenever there is any celebration at home, that is called a what? That is called as mood reactivity. Laden paralysis. Sometimes patient will be complaining about what? My limbs are very, very heavy. So these are atypical depression. Atypical depression. Always remember one point. Swag, suicidal tendency, weight loss, anhedonia, feeling of guilt. These four symptoms are classical symptoms of depression. Easy to understand? Or if there will be feeling of hopelessness, helplessness, worthlessness, 100% sign of what? Depression. Easy to understand? Fine. Okay. See, sometimes they're asking one-liner question and repeatedly asked question. Last time also they have asked one question related to rapid cycling. One is called as a dysthymia. Second is called as cyclothymia. Mild depression is called as dysthymia. Mild bipolar disorder is called as cyclothymia. If there will be depression and followed by mania, depression alone is called as unipolar disorder. But if there will be mania, mania will always be associated with depression. So this will be called as what? Bipolar disorder. Bipolar disorder. What I'm saying that milder form of depression, duration should be more than 2 years. Dysthymia. Milder form of bipolar disorder, duration should be more than 2 years. Cyclothymia. Now, major depression or depression more than 2 years, it is called a what? Chronic depression. Chronic depression. What is the meaning of double depression? A person who was suffering from dysthymia. देखो dysthymia का example याद कर लो. Suppose if A new engineer is there who is only 22-year-old. He comes to you, he asks you, sir, I'm feeling sad. I don't get so much happy in any kind of activities. I don't feel, like very happy. I don't feel that much energy. And one thing, like, I really do not enjoy so much in life. For last, like even when I was in second year of BTech, for more than 2 years, milder form of depression, that is, but duration is more than 2 years, that is called as dysthymia. Dysthymia. What is the meaning of the major depression? Anhedonia, insomnia, anorexia, weight loss, negative thoughts, suicidal tendency. These are major depression. Easy to understand? Fine. A person who was suffering from dysthymia, now there is attack of major depression. This is called as double depression. Dysthymia plus major depression is called as double depression. Double depression. Rapid cyclothymia and rapid cycling, these are related to bipolar disorder. If a person is having 4 episodes of mania or bipolar disorder in 1 year, or hypomania, whatever, equal to or more than 4 attacks of bipolar disorder in 1 year is called as rapid cycling. Rapid cycling. The question related to duration. Dysthymia more than 2 years. Cyclothymia more than 2 years. Okay, fine. How to see here on the basis of duration of diseases and symptoms, how you are going to diagnose some cases. To diagnose that a person is suffering from depression, symptoms should persist for 14 days. 14 days. If a person is suffering from mania, how many days is required to diagnose the case? 7 days. 7 days. If a person is suffering from OCD, 14 days. What about schizophrenia? Symptoms should persist for 6 months. 6 months. Sometimes they can ask you one-liner question also. Sometimes they can ask you one-liner question also. What about this one? What is the name of procedure shown below which is used to treat depression? See here, overall, now you tell me what is the treatment of choice, what is the drug of choice for depression? Overall, when I talk about schizophrenia, for schizophrenia, drug of choice is what? Atypical antipsychotic drugs or second generation. Okay. When I talk about schizophrenia, let's talk about neurotransmitters. There will be increased level of dopamine, serotonin, and norepinephrine. Easy to understand in limbic system. Okay. When I talk about depression, there will be decreased level of serotonin, norepinephrine, serotonin and norepinephrine. Mostly these two. Sometimes there will be decreased level of dopamine also. Decreased level of serotonin and norepinephrine. So that's why drug of choice for depression these days is SSRI. SSRI. This is the drug of choice for depression. Earlier there was TCA, but there were so many side effects. Now SSRI is the drug of choice. Okay, fine. Apart from medicines, we are also using some of the therapies. One is called as what? One is called as electroconvulsive therapy. With the help of electricity, I am going to produce convulsion with the help of electricity. But side effects are there, no? Side effects are there, right? Okay, fine. So now here we are using magnetic field. With the help of magnetic energy, there will be what? There will be stimulation of nerve cells so that a person can recover from depression. This is called as transcranial magnetic stimulation. This is called as transcranial magnetic stimulation. We are using, one is called as ECT. One is called as ECT. Second is called as the transcranial magnetic stimulation. No electricity, nothing like that. Related to ECT, some questions will be there. Earlier, we were not using anesthesia. That was called a direct ECT. Direct ECT. Direct ECT. Because of that, side effects were there, dislocation of tooth or fracture of bones. Now we are using anesthesia also. So now with anesthesia, it is called as indirect ECT. Indirect ECT. Indirect ECT. Now the question is that, what is the anesthesia of choice for ECT? It is what? Methohexital. Methohexital. Why it is considered as the drug of choice? Why it is called as the anesthesia of choice? Because side effect of methohexital is what? Convulsion. Convulsion. This is what we require in ECT. So basically there will be what? Excitatory side effects, right? Okay, fine. So whenever we are giving ECT, what are the side effects? These days with anesthesia, when we are giving, no, side effect is what? Memory loss and headache. Fine. So now why actually TMS is getting popularity? Because we don't have to give anesthesia, no electricity. So patient will be in safe zone. Transcranial magnetic stimulation. Third, vagus nerve stimulation. With the help of stimulation of vagus nerve, we are going to stimulate multiple nerve cells there so that person can get rid of depression. Okay, fine. So this is what? Transcranial magnetic stimulation. Now the question is that ECT, if a female is actually pregnant, she is having what? Severe depression with suicidal tendency. Can we give ECT or not? Baby can come again. You have to save mother's life first. So please understand that pregnancy is not a contraindication of ECT. ECT can be given. Now, question is, what are the indications of ECT? What are the indications of ECT in depression? Depression along with suicidal tendency, along with psychotic symptoms. If there will be stupor means what? Immobile, or when patient will not be responding, no response to other modalities of treatment. In these conditions, ECT can be given. Next, a 60-year-old female is brought to hospital by her kids. Okay. They are saying that she has gone senile. She lost her husband 6 months back. And after that, she has become very religious, spiritual, and giving lots of money in donation. She is occupied in too many activities. She sleeps only for 3-4 hours, but she is always full of energy. She now believes that she has a goal to change this society. She does not like being brought to hospital and is argumentative on being questioned on her doings. Please understand that mania or bipolar disorder, this is a psychotic disease, right? Psychotic hai na? It is not neurosis, hai na? So yahan pe patient has absence of insight. Absence of insight. So what is the diagnosis here? Easy question. This is what? Mania. This is not depression. See, do understand that even negative symptoms can precipitate mania. Mania means what? Hyperactive. See, she became very, very religious. Now she is donating so much money. She is sleeping only for 3 to 4 hours, but she is full of energy. She believes that she has a goal to change this society, full of energy. Fine now? So, answer is what? Mania. Mania. Okay? So please remember that mania can occur even after negative events in life also. Full of energy, full of work, over talkativeness. Okay, so delusion, like feeling of grandiosity. Okay, now decrease need of sleep. All these are symptoms of mania. Next. A 28-year-old female on antidepressant presents to the emergency with altered sensorium, dry mouth, blurred vision, hypotension. Dr. Sai Swarup, yes, we are doing both subjects. Yeah, class will go up to 10 o'clock. Okay. After psychiatry, we are going to discuss forensic also. Don't worry. Okay. Yeah, but after the T&D, you will be having, these subjects will become very, very easy for you. I'm telling you. चलो ठीक है, बताओ क्या है? ECG reveals wide QRS complexes and right axis deviation. What is the diagnosis? Antidepressants. Earlier we were giving TCA, tricyclic antidepressant, which were blocking what? Serotonin and norepinephrine. Okay, fine. But this was also blocking. See, what was the negative points, or what were the negative points of TCA? See, these were blocking serotonin and norepinephrine. So because of this, there was elevation of serotonin and norepinephrine. Okay. Depression could be improved. But this was also blocking muscarinic receptor, histamine receptor. This was also blocking alpha-1, alpha-2 receptor, and also blocking sodium channel of heart. Because of blocking of muscarinic receptor, now there were different symptoms like, okay, no, cholinergic type, what? Dry mouth, है ना? Blurred vision, urinary retention. Fine? Okay, fine. Histamine की वजह से क्या था? Sedation. Patient was sleeping a lot. Alpha-1, alpha-2, what? Hypotension. Because of sodium की वजह से क्या था यहाँ पे? है ना? Sodium channel of heart. What was that? So there was what? Arrhythmia type. So basically all these are what? Toxicity of TCA toxicity. Earlier TCA was the drug of choice for depression, but there were so many side effects. So now that's why we are giving what? SSRI. Okay? Fine. So how to treat TCA toxicity? See, please understand that there can be hypotension. Along with that, there can be metabolic acidosis also. This is very, very dangerous. So we have to treat this also. So we have to do what? Serum alkalinization. How? By sodium bicarbonate. IV sodium bicarbonate. Please understand that whenever there will be TCA toxicity, you have to give what? IV sodium bicarbonate. Okay. So if I say that, when I say that, there can be blurred vision. So if a patient of glaucoma is having depression, are you going to give him TCA? No. Right? No. Now, the question is that, there will be side effect like urinary retention is also there. If a patient of BPH has got depression, are you going to give him TCA? No. Next question. Like some extra points, please understand that there can be two physical symptoms in depression. One is called as omega sign. Second is called as the Viragat fold. These two can be your picture-based question. This side or this side. Omega sign above the root nose here. Omega sign here. This part. Viragat fold. Triangular fold near nasal corner. Viragat fold. These are the two signs which are seen in depression. Next, a wife is getting restless when her husband does not reach home on a regular time. Every day he used to get back by 5 p.m. But what happened? like that day, he did not reach on time. Now his wife is restless. Husband phone is also switched off. And she got to know from his office that he left on time. Now she gets nervous, sweating, tachycardia, cold, clammy skin. What is the diagnosis? Okay. Some of you are saying anxiety and some of you are saying panic attack, right? Panic attack. Do you understand how to differentiate anxiety disorder, panic attack, and PTSD? I'm going to teach you very, very important. You can get one question and you have to mark it right. See what is happening here. Please understand that there are two types. One is called as, see here, anxiety. One is called as anxiety. One is called the phobia. Anxiety is a response to an unknown threat. Unknown. You don't know the real cause why you are having anxiety. Overall, most common psychiatric disorder is anxiety. One question. What is happening here? A wife, see here, now you understand the situation. After that, you will never forget it. Okay, you will never forget it. See what is happening here. When a wife who was waiting for her husband every day he used to come back at 5 p.m. But now what happened today? Now it's 5:30. He did not get back. Now what is happening here? Now she gets what? Restless. Okay, now she made a phone call to her husband, phone is switched off. She made a phone call to the office. Okay, he left on time. Now she's having, oh my God, what happened? Might be accident, might be extramarital affair. Might be, it could be. Now she's what? Very, very restlessness. After that, she's moving from here to there. Again and again, she's going to check the door. Okay, now she's having what? Now she's having what? She's having the tachycardia. She's having the sweating also. Now when she touches her skin, this is very, very cold. Now what is happening? When she's going to open the window, after that, she's able to breathe normally. I know she's having restlessness, tachycardia, hyperventilation. Okay, see after that, what is happening? Now it is 5:45 p.m. Now again at this time also he did not get back. All these symptoms are there. She does not know what happened actually. Suddenly at 5:50 p.m. there was a doorbell. Husband entered the room. After that, he asked her, hey, what happened? Why you will not understand what happened to me. What happened? After that, she's moving here to there. After when she's sitting on the sofa for 5 minutes, now she's becoming normal. All these signs and symptoms are symptoms of anxiety. Only anxiety disorder. That's it. Feeling of, see here, nervousness, sweating, tachycardia, restlessness. See, there can be what? Mydriasis also. After a certain time, there will be increased level of frequency of urination, diarrhea also. These are symptoms of anxiety. Now, how to differentiate anxiety attack, which is also called the panic attack? These symptoms, anxiety. Attack is serious. Next question, please. Patient presented to casualty with acute onset of breathlessness, palpitation, now pain in chest. All these symptoms started when he received a phone call from unknown number. He is extremely scared, screaming. He's screaming that his heart will come out of his body. The patient will speak. He will say that, sir, पूरे मेरे दिल की धड़कन ऐसे बढ़ गई जैसे ऐसा लग रहा है मेरा जो है ना दिल बाहर आ जाएगा. Fine. On examination, ECG normal, chest X-ray normal, all other investigations are normal. Just after getting a phone call from an unknown number, a person is getting what? Okay, suddenly after that he was having what? See here. See, after that he had what? Tachycardia, palpitation, pain in chest. Do remember, all symptoms like anxiety. All symptoms like anxiety. Plus add one more symptom like heart attack. Pain in chest will be called as panic attack. Panic attack. Easy to understand? Panic attack. So what is happening here? Whenever you are getting this kind of patient in your emergency department, when patient is having what? Tachycardia, palpitation, pain in chest, first of all, you have to start with ABC, airway, breathing and circulation. You have to treat him like a patient of heart attack only. Maybe myocardial infarction, you don't know, right? Maybe. But if ECG is normal, okay, see here, all enzymes, okay, the TROP-T enzyme, All in the myocardial infarction, enzymes are normal, ECG normal, X-ray is normal. After 5 to 10 minutes, patient is also normal. It means what? There was panic attack. Panic attack. One more important thing you have to remember. Whenever there will be panic attack, no, there will be fear of death. Fear of dying and losing control. Feeling of impending doom. Doomsday का मतलब क्या होता है? What is the meaning of doomsday? Last day on the earth. Fear of dying. Fear of dying. This is what? Panic attack. Panic attack. Okay, no? Panic attack. Easy to understand? Very good. Very good. Next. A 20-year young man with a history of fall in a river, who was saved by people while drowning 2 months back. 2 months back it has happened. Present with complaints of dream about drowning. He has visualization of the same scene whenever he visits any pond or river and is scared of going back to the incident site. What is the answer here now? Which type of disorder can be diagnosed? Yes, Dr. Daniel, yes. Heart attack symptoms, agar aa gaya, if there will be heart attack symptoms, no, you should diagnose what? Panic attack. देखो यहाँ पे है ना, so fear of death, panic attack. But whenever there will be flashback and nightmare, flashback again and again in this question, post PTSD, right? After the trauma, there will be stress disorder. Flashback and nightmares. Remember, flashback and nightmares. Because of this, they will avoid of going to that place again and again, right? There can be insomnia and all, right? There can be insomnia. I know hypervigilance. There can be anhedonia and all. How to treat? First line is what? SSRI. But overall, the treatment of choice is behavior therapy. One important question you can remember, that is eye movement desensitization reprocessing. See, I already have explained you all these when I have taught you in the class. Okay, remember only one point. Sometimes they can ask you one-liner question. EMDR is used for which psychiatric disorder? This is for PTSD. Next. A 17-year-old boy feels that dirt has hung onto him whenever he passes through the dirty street. This repetitive thought causes much distress and anxiety. He knows that there is actually no such thing after he has cleaned once, but he is not satisfied. He is compelled to think so. This has led to social withdrawal. He spends so much of his time thinking about the dirt and contamination. Basically, kya hai ye batao? Checking again and again. That is what? OCD. No, easy question, right? OCD. Right. See, there are 4 types of OCD, 4 symptoms. One is OCD of contamination. Second is OCD of pathological doubt. You locked your room and after that you left. After that you are thinking that, I think I did not lock my room. Again, you will go, you will open, again, you will close. Again and again, pathological doubt. If a female will be having this kind of OCD, that whenever she is going to cut the vegetable, each and every part of the vegetable should be of equal size. Symmetry, right? Symmetry. Suppose if a person is thinking that he is having sex with the God, after that he will be having what? Severe anxiety. Oh my God, how could I think like this? Intrusive thoughts, weird thoughts. OCD is also because of imbalance in serotonin. So that's why drug of choice for OCD is SSRI. But what are the best management for OCD? CBT, behavior therapy, exposure and prevention. Please remember that for phobia, for OCD, what is the best management? Exposure and response prevention. Basically, behavior therapy. Okay, fine. Now the question is that related to OCD, how many days are required? To diagnose OCD? Same, 14 days. How many days are required to diagnose depression? 14 days. 14 days. 14 days. Please remember that. OCD, now you tell me OCD of contaminant. OCD, patient will be aware about his disease or not? Yes or no? Yes. Okay, fine. So basically, do you think he can go into depression because he is wasting so much of his time? Yes. So this will be what? Ego syntonic or dystonic? This will be dystonic for sure, right? No? Dystonic hoga na, because he gives. This will be dystonic, no? Because he understands, because of this, he is going into depression. So do understand that what is the most common comorbidity associated with OCD? It is depression. Depression is associated with OCD. Depression. Okay, one more question related to PTSD. Please understand that. See, for PTSD is a disorder of young age group, mostly in second decade. Symptoms will persist for more than 1 month. Similar symptoms less than 1 month. Similar symptoms like PTSD less than 1 month is called as acute stress disorder. How much duration is required to diagnose schizophrenia? More than 6 months. Symptoms like schizophrenia, but duration is less than 1 month. It is called as acute psychotic disorder. Acute psychotic disorder. Easy to understand? Please remember all these points. Next, a 40-year-old man reported to psychiatric OPD with the complaints of fear of leaving home, fear of traveling alone, fear of using closed elevator, fear of being in crowd. He develops marked anxiety with palpitations and sweating if he is in these situations. He often avoids public transport to go to his place of work. What is the most likely diagnosis? Easy question hai, batao. Acha, some of you are saying claustrophobia. Acha ji, chalo theek hai, pakde gaya kuch. Claustrophobia hai. No, but most of you are correct. See, when I am saying about, when I say fear of closed space, closed and dark, only closed, to claustro hai. Only dark, when I say only dark place, that will be considered as nyctophobia. Nyctophobia, right? Nyctophobia. When I'm saying only closed space, claustrophobia. When I'm saying closed plus open, closed plus open, when a person is having fear of going into a closed room or elevator or going somewhere alone or traveling somewhere alone, even if you keep him in a crowded place, even if you keep him in a desert place where he's completely alone in an open place, he will be very, very scared. Closed plus open, this is called as agoraphobia. Agoraphobia. Answer is agoraphobia. You have to be very, very much careful. You have to be very, very much careful. Easy to understand? Fine, no? Right. So phobia is very, very important. See, only a dark place. No, only a dark place. Nyctophobia. Nocturnal hota hai, nycto matlab night. Only dark hai, so nyctophobia. Nycto. Closed place, closed and dark place, band hai na? So that will be what? Claustrophobia. Closed plus open phobia, agoraphobia. Avoidant personality disorder, you are asking Dr. Chaitanya. Avoidant personality, here there will be fear of rejection. Here patient does not have fear of rejection. No, he's working normally, right? No. So answer will not be C. You have to be very much careful. Basically, he is having phobia only, no? Phobia, fear hai. Fine, no? So either claustro or agora, answer is agoraphobia, right? Okay, some specific phobias are there because phobias are very, very important right now. So let's learn all the phobias. Just have the fast revision. How to remember all the phobias? Divide the words. Okay, no? See here. Arachno means a spider. Arachnophobia. fear of a spider. Ophidiophobia, see, we have learned in forensic now. Ophiotoxemia related to a snake, right? Ophidiophobia, fear of a snake. Aeroplane, aerophobia, fear of flying. Glossa bole to tongue. Glossa means tongue, fear of public speaking, glossophobia. Ornithology, study of birds. Ornithophobia, fear of birds. Rypano, needles. Hemoglobin, blood. Hemophobia, fear of blood. Vehicle, no? Vehicle, right? Fear of driving. Iatrogenic injury. Iatrogenic injury means what? Doctor, है? A doctor who caused the injury, iatrophobia, fear of doctors. Nosocomial infection क्या था? Hospital acquired infection, nosocomophobia, fear of hospital. Phasma or spectra, ghost. Astra, thunder, fear of thunders or lightning, also called the brontophobia or nitrophobia. Cyno, dogs. Claustro, closed place like elevators or a small room. Claustrophobia, fear of closed spaces, closed places like elevator and a small room. Claustrophobia. Agoraphobia, basically, if you have to remember agoraphobia, remember it. Fear of closed place or open place. Whatever the place, actually fear of place from where escaping is difficult. Escaping is difficult. It could be open place or crowded place. Xenografting kya tha batao? Xenografting, isografting, allografting, autografting. Xenografting from different species whom actually you don't know. Xenophobia, fear of strangers. Zoo, animals. What we have learned in forensic medicine related to thanatology, study of death. Okay, thanatophobia, basically कौन सा word है ये? Avengers. Okay, Thanos, है ना? Thanos, death. Acrobics, height, fear of heights. Alluro means cats, allurophobia. Hydro, water, you see in rabies, right? Meso, germs. Pyro, fear of fire. Please remember all phobia. Fear of woman kya hota? Fear of woman, gynephobia. Gynephobia. Remember all these phobias. There are 4 methods of the management of phobia. See here, please remember that overall, if they are going to ask you, what is the best method of management of phobia? See, do remember, if they are asking related to drugs, SSRI. But what is the best treatment, exposure and response prevention? Or you can say what? Behavior therapy. Along with pharmacotherapy, this is the best. So, what is the exposure and response prevention? What is the behavior therapy, where also you are giving what? Drug. That is called a systemic desensitization, which we already have learned a lot, right? Fine. Next question. A 45-year-old female is admitted in hospital with complaints of abdominal pain and headache. General physical examination revealed 5 scars on the abdomen from previous surgeries. She seems to maintain a sick role and seeks attention from the nurses and doctors. She demands multiple diagnostic tests, including a liver biopsy also. The treating team failed to diagnose any major physical illness in the patient. Her mental status examination did not reveal any major psychopathology. She looks completely normal. One of the treating staffs recognized her to have appeared in several other hospitals with abdominal pain and some other vague complaints. What is the diagnosis? Malingering means lying? No. Please understand here, very, very important topic, very, very important. And this can be your MCI question. One is called the Munchausen syndrome. One is called as Munchausen syndrome, which is also called as hospital addiction. Munchausen syndrome, hospital addiction. Fine. What is happening here? Here a patient will produce fake symptoms. Fake symptoms. Fake symptoms just to get the attention of medical staffs. He will demand for inpatient care. Inpatient care. This is called as Munchausen syndrome. Munchausen syndrome, which is also called as hospital addiction. It is also called as factitious disorder. Factitious disorder. Overall, what is the intention here? Just to get the attention of medical staffs like nurses and doctors. Factitious. But what is happening here? A 55-year-old doctor is there who does not have any kids. Now there is a 5-year-old baby in his department. Now this clinician is producing fake symptoms so that baby should be admitted in his department for some more number of days. When a clinician is producing fake symptoms, it is called as Munchausen syndrome by proxy. Munchausen syndrome by proxy. Remember, very, very important. So what is the answer here? Munchausen syndrome. Answer is B. Munchausen syndrome, also called as factitious disorder, hospital addiction. When a patient fakes some symptoms to get admission in hospital, just to get the attention of doctor and nurses, Munchausen syndrome. But if clinician is faking symptoms, it is called as Munchausen syndrome by proxy. Easy to understand? Fine. Next question. A non-diabetic, non-hypertensive patient has some extra beats in pulse. Doctor informed that it is benign and no intervention is required, but the patient is worried that it is a serious cardiac disorder, and still going for repeated investigations and going from doctor to doctor. Now here we are going to explain what? Somatization disorder. Right now, somatization disorder. Please understand that you can get a patient who does not have anything, no diseases, even see, in spite of all negative reports and reassurances by the doctors, patient will visit multiple doctors, patient will seek multiple consultations. That is called as somatization disorder. Somatoform disorder means unexplained disorder, no physical symptoms. So now please understand here that two important points, related to two important points. When patient is having multiple pains, like at shoulder, stomach, headache, okay. After that, GIT symptoms like nausea and vomiting, CNS symptoms like mental confusion, sexual problem like lack of libido. Okay. And so this is one patient. I have one more patient who does not have any symptoms, no symptoms at all. No symptoms at all. I have one patient who is having symptoms. Who is having symptoms. Means patient will say, sir, I am having abdominal pain. Pain will be there for sure. Pain will be there for real. He is not faking symptoms. That's why this is not factitious disorder, Dr. Avni Pradeep. This is not factitious because he is not faking symptoms. He will feel the symptom. He will have the pain. In the beginning, you have to give the painkiller also. He will have pain for sure. Symptoms are there for sure. Unexplained disorders. This is called as somatization disorder, which is also called as Briquet syndrome. Briquet syndrome. Briquet syndrome. And I'm having one more patient that is called as B, patient number B, patient B. He does not have any symptoms, but he's saying that, doctor, I'm thinking that I'm suffering from a disease. Please check me, please. No symptoms, only idea of having a disease that is called as hypochondriasis. 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 I hope everything is clear. If only pain, if patient is saying, sir, I'm having only pain in my abdomen, only pain, somatoform pain disorder. More than one symptom, somatization disorder. No symptoms, only ideas of having any disease, hypochondriasis. Hypochondriasis. I hope this funda is clear to all of you. अब इसमें कोई कंफ्यूजन नहीं होना चाहिए लाइफ में. Hypochondriasis, somatization, multiple times they are asking the question. So if I am focusing on symptoms, I'm talking about somatization. If I'm talking about diagnosis, directly diagnosis, I'm talking about hypochondriasis. Easy to understand, no? Now there should not be any confusion. Fine. Very good. Somatization means what? There will be symptoms for sure. There will be symptoms for sure. Hypochondriasis. See, like in spite of all the negative reports, patient will be having symptoms. Somatoform, unexplained. So that is somatization. Hypochondriasis means what? Preoccupation with the fear of having, or the idea that one has one or more serious illnesses. Fine now? Hypochondriasis. Next. So in this manner, we have completed that chapter also. Let's see, like neurosis and all. Fine. Which of the following is a differentiating feature between delirium and dementia? Delirium and dementia. Dr. Ashwini Thomas, if only one symptom, only pain is there, that will be called a somatoform pain disorder. But if there is no somatoform pain disorder in the option, you have to mark what? Somatization only, right? Now, question number 36. See, when I talk about organic mental disorder, we should talk about delirium and dementia. Delirium and dementia, first of all. See here, delirium and dementia. Delirium and dementia. Delirium and dementia. If a person is admitted in hospital for last 7 to 10 days, long hospitalization, big surgeries, major surgeries. In the beginning, patient was normal, but suddenly there will be acute onset of symptom. Now patient will be disoriented to time, place, and person. A patient who was admitted in my boss department suddenly refuses to recognize me. He is asking me, who are you? He is not recognizing his own brother and sister. Sudden onset of symptom is called as delirium. Disorientation to time, place, and person. Acute onset, fluctuation of symptoms. See, there can be short term. There can be what? Short term psychosis, like delusion and hallucination. Sometimes there will be what? See, like there will be disorientation, no? Disorientation. Or you can say mental confusion. You can also say clouding of consciousness. All these are same thing. Clouding of consciousness, altered sensorium, disorientation to time, place, and person, mental confusion. All these are same things. These are seen in delirium. These are not seen in dementia. These are not seen in dementia. Dementia, there will not be acute onset. Dementia, there will not be fluctuation of symptoms. Dementia, there will not be loss of consciousness, no clouding of consciousness. Easy to understand. So acute onset is seen in delirium. Okay, now the question is that how you are going to differentiate delirium and dementia with schizophrenia. With schizophrenia. First of all, in delirium, acute onset. In schizophrenia, no acute onset. There will be the progressive, and it will take a long term. Delirium, clouding of consciousness. Schizophrenia, no clouding of consciousness, no disorientation. In delirium, see, in delirium, there will be short-term delusion and hallucination will be there, but only for a short interval of time. In schizophrenia, delusion and hallucination will be constant and long. Option B, clouding of consciousness is seen in dementia. That is wrong. No, clouding of consciousness is seen in delirium, not in dementia. Right? Okay. Fine. Easy to understand? Okay, चलो अब ये बताओ, अगर schizophrenia है, see, schizophrenia IQ will be normal. Schizophrenia IQ will be normal, but schizophrenia along with mental retardation. Yeah, Dr. Princey, please understand that yes, short-term delusion and hallucination will be seen in delirium also, dementia also. Delirium and dementia, both hallucination will be there. Okay, short-term only, not a long-term. See, now question is that schizophrenia along with mental retardation, this is called as which type of schizophrenia? Yeah, this is called the schizophrenia. Schizophrenia along with self-mutilation. A schizophrenic patient who harms himself, who cuts himself, who is having self-mutilation tendency. This is called as von Gogh syndrome. No, von Gogh. Easy to understand. Remember, schizophrenia and von Gogh syndrome. Von Gogh, schizophrenia along with self-mutilation. Remember it. Next, a 3-year-old child has normal development milestone except delayed language development. He has difficulty in making friends, not able to pay attention and concentration. Most of the time he is seeing his own hands. What is the probable diagnosis? Which type of schizophrenia is having worst prognosis? One doctor is asking simple schizophrenia, not hebephrenic. Okay. चलो ये बताओ इसका आंसर क्या होगा? Now we are learning the pediatric psychiatry. See, whenever there will be problem in communication. Okay. Whenever there will be problem in social interaction, whenever there will be stereotyped behavior or repetitive behavior, answer will be what? Autism. Answer will be what? Autism. See this question, no? Autism means what? So what is the meaning of this word? Social interaction problem. Problem in social impairment, poor eye contact, lack of social smile. He is not able to make new friends, difficulty in making friends, stereotyped behavior, repetitive behavior, playing with the car every time, same car, see here. Fine, no? Fine. So he spends most of his time seeing his own hand. Autism. There can be mental retardation also. So see, approximately 30% patient will be having what? Mental retardation. What is the new name of mental retardation? New name of mental retardation is what? Intellectual disability. Now question is, see, now there is autistic spectrum disorder. If a person is having normal IQ, okay, now see here, if IQ, social and language, both are impaired, answer will be what? Autism. Okay. Next, IQ is normal. IQ is normal. Social IQ is normal. Language is normal. Only social impairment. Only social impairment. है ना? Only social impairment means poor eye contact, inability to make friends. Fine now? Now this will become what? My name is Khan, which is what? Asperger syndrome. Asperger syndrome. Easy to understand. Asperger's syndrome. Easy to understand. Asperger's syndrome. I hope you have seen the movie of Shah Rukh Khan. My name is Khan, right? Khan from Epiglottis. Fine. Now next. IQ is normal. Language is normal. Social, everything is normal. But whenever he is writing exam, he is getting failed. He is getting failed. Answer is what? Learning disability. Learning disability. Learning disability like dyslexia. Dyslexia. Easy to understand. I hope this is clear to all of you, right? Next question. See here. So when I said that whenever there will be problem in the language, social impairment, and there will be stereotype behavior. But if you are getting a patient that a child is not able to pay attention in classroom, he is always disturbing other children, hyperactive, he is not able to wait for his own turn when a teacher is asking the question, he is very impulsive, inattention, hyperactive and impulsive. Now diagnosis will be attention deficit hyperactive disorder. Attention deficit hyperactive disorder. Pediatric psychiatry, most important topic is autism. Second is ADHD. ADHD. So please understand that if you do not treat the child on time, he is having higher risk of development of depression in future. Maybe avoidant personality disorder, or maybe antisocial personality disorder, or maybe substance abuse like alcoholism. So you have to treat on time. What is the drug of choice? Methylphenidate. 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 That is the drug of choice. Methylphenidate, which is actually what? CNS stimulant. CNS stimulant. Methylphenidate. But in all cases, you cannot give CNS stimulant. In some special cases, you have to give non-stimulant. Non-stimulant. If there will be history of substance abuse in the family of child. Suppose if father was a drug abuser, because CNS stimulant will be having drug dependency. History of substance abuse. Along with if child is also having seizure, then you have to give non-stimulant like atomoxetine or the clonidine. Atomoxetine. Remember all these points, all these are important questions. Which of the following is the best therapy to teach daily life skill to a mentally challenged skill? Basically, I'm talking about what? Mentally retarded person. New name of mental retardation is what? Intellectual disability. What is the best therapy to teach daily life? Please understand that one is called as CBT, cognitive behavior therapy. If a patient of schizophrenia who has forgotten so many skills, action, how to comb his hair, how to button his shirt, how to behave in a social gathering, cognitive behavior therapy, where we teach them the cognition. Second is called as CRT, cognitive remediation therapy. This we are using to improve the memory. Cognitive remediation therapy. Cognitive remediation therapy. Patient of schizophrenia who has forgotten everything, I have to improve his memory. Cognitive remediation therapy. Third is dialectical behavior therapy. This is, yeah, see the dialectical behavior therapy. This is serious type of behavior therapy where a patient is having suicidal tendency, like like the borderline personality disorder, or a patient of depression. You have to teach them. Don't harm yourself. Dialectical behavior therapy. Last is contingency management. Contingency management. Contingency management. This is for mental retardation. Desired behaviors are rewarded, undesired behaviors are punished. This is called as contingency management. Answer D is right. So do remember, see, they are asking one question. Normal IQ is 90 to 109. 90 to 109. Less than 70, mental retardation. Okay, fine. They will ask you, a patient is having 55 IQ. 55. He's suffering from mild mental retardation, moderate, severe, or profound. So 50 to 69. 50 to 69 is mild. 35 to 49, moderate. Please remember the IQ number. Repeatedly asked question. Okay. Next question. Which of the following is known as executive organ of the mind? Sigmund Freud, he taught about the topographical theory of mind. He said that one part of mind is saying that, one part of mind is saying that I want to enjoy, I want to enjoy, I want to enjoy. Enjoyable, id. Yeah, but one part of mind, no, you have MCI exam, you cannot enjoy, you have to study, That is super ego. And one part of mind is saying, okay, fine. So see what is happening, and when id and super ego will fight, okay, for sure there will be what? There can be development of anxiety, there can be development of anxiety. To reduce the anxiety, in between ego will come. Ego will say, okay, fine, do one thing. Okay, you study for 5 hours and watch movie for 1 hour. Okay, fine. Now it is going to balance it. Fine. No? So ego works on, see here, please understand that. It works on pleasurable principle. I want to enjoy. Suppose if one FMG aspirant, if you are saying now you want to enjoy, id, pleasurable principle. Super ego, moral principle. You have to study. Okay, fine. Do one thing. Let's balance it. Let's balance it. Study for 5 hours, watch movie for 1 hour. This works on reality principle. So ego is called as executive organ of the brain. Executive organ of mind. Okay, no? So ego basically, it is balancing it. That is what? So that mechanism is called as, yes, Dr. Vignesh. Okay, so that is called a what? Defense mechanism. All defense mechanism which I have taught you in class. I know defense mechanism will be, okay, defense mechanism will be played by, okay, no, so that will be played by ego, right? Fine, next. Yes, Dr. Sethu. अब बताओ ये क्वेश्चन नंबर 40. One word is there that is called the transference. Opposite is called the counter transference. During the psychotherapy, during the treatment, sometimes patient will develop some emotion for the doctor. That is called as transference. Patient will develop, you might remember that movie, Dear Zindagi. Shah Rukh Khan was psychiatrist, Alia Bhatt was patient, right? Fine, no? So Alia Bhatt fell in love with Shah Rukh Khan, with the clinician. Development of emotion for the clinician is called as transference. Sometimes if patient is beautiful, even clinician can develop emotion for the patient. That is called as counter transference. Real development of emotion, I'm telling you. Fine, no? That is called as, and that is called as counter transference. So answer will be what? Doctor's feeling towards patient. Answer is B. Counter transference. अच्छा, वो क्या पढ़ा था हमने? वो क्या पढ़ा था? If a patient is faking some symptoms to get admission in hospital, what was the name of that disorder? बताओ क्या था वो? Factitious disorder, hospital addiction, or Munchausen syndrome. Dr. Sairup, not malingering, no, Munchausen syndrome. If patient is faking symptom, Munchausen. Clinician is faking symptoms, Munchausen syndrome by proxy. Their symptoms are fake. Counter transference and the transference, here emotions are actually real. Next question. Castration anxiety is seen in which age group? See, Sigmund Freud, he said that psychosexual, he described about psychosexual stages of development, right? Oral, after that anal, after that phallic, and then latent, and then genital. Oral, age duration for oral stage 0 to 1.5 year, anal 1.5 to 3 year, phallic stage there will be 3 to 5 year, latent 5 to 12 year, more than 12 genital. Sigmund Freud, who is also known as the father of psychoanalysis, who coined the term id, ego, and superego. He said that even a child of 1 year, he also derives sexual pleasure by sucking the thumb or by chewing it or by, okay, fine. Or anal stage, when a child will be getting what? This one. So this time he will feel what? He will feel like a tie. He will have a sense of achievement. Anal phase, he will enjoy it. Phallic stage, see here, where a child will be having what? Phallic stage. Here, most important organ for both of these sexes, male and female, is penis only. Penis. Fine now? Here, what is happening here? In this age group, a son will develop sexual attraction, sexual feeling for mother. That is called as what? Son to mother. That is called as Oedipus complex. So whenever a father will get back from the office, okay, that son, he will fake some symptom. He will say that, oh my God, I'm having abdominal pain. He will hold his mother. He will hold his mother. He will not allow his father to touch his mother. Even when father and mother, they are sleeping, okay, son will go and sleep in between so that they should not touch each other. Oedipus complex. Okay. When daughter will develop sexual feeling for father, it is called as Electra complex. It is called as Electra complex. Oedipus complex, Electra complex. These two are seen in phallic stage, 3 to 5 years. But at the same time, when son is having this kind of feeling, no, that okay, son is having this kind of feeling for the mother. At that time, he will be anxious, so he will be scared of his father also, that if his father will come to know, he will castrate him. So castration anxiety will be seen in boys. Castration anxiety. Easy to understand? Easy to understand? Fine, very good. Next, a drunk man who lost his son while driving started a drunk man who lost his son while driving started a campaign against drunk driving and educate people about alcohol. Which type of defense mechanism is this? See here, see, I have taught you in detail all defense mechanism. Please go through all the defense mechanism at least for one time. You can expect one question. Okay, now? Yeah, this is what? Altruism. Fine now? Helping others, satisfying internal needs by helping others. Reaction formation. I give you the example that suppose if there was a beautiful intern like who has joined the hospital, one PG resident who has started liking her. Okay, her name is Rima, right now? And suddenly, but every day he will just keep, okay, he will just keep eyes on her, line marna kaise usko, right? Like every day he will be looking on like on Rima. But see, like your colleagues will understand it. Okay, after 1 week, your colleagues are saying, hey, you like Rima. Nah, I hate her. Nah, she is ugly. Forming reaction exactly into opposite. This is called as reaction formation. Because if he will be caught, this will be an embarrassing situation. No, right? Easy to understand? Fine. That is reaction formation. Isolation of affect. Fine. Isolation of affect. Affect means emotion. A female who got diagnosed by breast cancer. She tells her mom that, yes, mom, report came. I got diagnosed by breast cancer. Don't worry. Next week I have surgery. Okay, let me sleep. Okay, please don't disturb me. She is hiding her emotion. Hiding her emotion. If she will show her emotion, she will cry, her mom will cry, everyone will cry. Undoing. Doing an act to nullify the previous act. Husband and wife, they fought last night. And in the morning tomorrow, what is happening here? Husband is presenting a bouquet, a gift to his wife, and he's saying, sorry, darling. Undoing. Fine? Undoing. Remember all defense mechanism, please. Okay? Chalo, fine. Next. Okay, next. A 49-year-old chronic alcoholic male presented to emergency department with complaints of fearfulness, misrecognition, talking to self, and there will be, remember also, aggressive behavior, seeing snakes, hallucination also, right? That are not visible to others. There is history of last drinking alcohol 3 days prior to onset of present symptoms. What is the most probable diagnosis? Basically, this is what? This is alcohol withdrawal case. Alcohol withdrawal symptom. Please remember rule of six. First symptom after cessation of alcohol is what? First symptom or classical symptom? Tremors after 6 hours. Apart from GIT symptoms and all. After that, after 12 hours, seizure, which is called as cluster seizure or REM fits. Okay. After 24 hours. ये तो कि 24 आवर्स के बाद ये बताओ कि 12 आवर्स में सीजर था हेलुसिनेशन था बताओ आंसर मी प्लीज after the 12 hour there will be hallucination okay no hallucination alcoholic hallucinosis okay no alcoholic hallucinosis okay fine and after the 24 hour there will be seizure which is called as cluster seizure or REM fits. And after 48 hours, अब क्या होगा बताओ? After 48 hours, basically after 2 days, there will be a delirium that is called as delirium. कौन सा था? Tremens. After 48. So this is the rule of 6. Repeatedly asked question related to withdrawal symptoms. This is very, very serious condition if you do not manage the patient on time. Always one question will come from here. देखो, एक है postpartum depression, psychosis and blues, always. और एक है alcohol withdrawal symptoms related to duration. ठीक है, more than 2 days हो गया, delirium remains will be there, right now, fine now. So this is a type of serious condition. If you do not treat your patient on time, mortality rate will be 20%. 20%. So what is the diagnosis here? In this case, alcohol कब लिया था last? More than 2 days. More than 2 days. Answer will be what? C. C. Easy to understand? Please remember this one. How to treat? How to treat the alcohol withdrawal symptoms? You have to give what? Benzodiazepine. Benzodiazepine like chlordiazepoxide or diazepam. Chlordiazepoxide, diazepam. Even you can give alprazolam, right now. So remember this rule of 6 hours. Rule of 6 hours. Next. अच्छा, एक और चीज था यहाँ पे related to this one, no? Option number B. See, related to option number B. Whenever there will be Goa, global confusion, ophthalmoplegia, ataxia. This is called a what? See, this is called a what? Wernicke's encephalopathy. Wernicke's, right now? Wernicke's encephalopathy. And if there will be longer time, that will see that can progress to Korsakoff syndrome also. Korsakoff psychosis. Korsakoff psychosis. Whenever there will be amnesia, so many other problems will be there. Korsakoff. See, Wernicke's encephalopathy and Korsakoff syndrome. Korsakoff syndrome. What is the pathophysiology here? Deficiency of which vitamin? Deficiency of vitamin B1 or deficiency of vitamin thiamine, right? Thiamine. Easy to understand? Fine. Next, a chronic alcoholic patient stopped alcohol intake for 2 days. Developed symptoms of withdrawal on first day. On second day, he has GTCS, generalized tonic-clonic seizure. Which drug should be given to control his symptoms? Basically, this is a case of what? Alcohol withdrawal symptoms, right now. So we see, please understand that even if you have to do what? Even if you have to do what? Decontamination, fine now? De-addiction, you have to give a substitute. So you have to give something similar to alcohol, no? So that is actually benzodiazepine. Benzodiazepine. So this is what? Diazepam. Diazepam. अच्छा, something related to, देखो यहाँ पे ना alcohol से कुछ और भी questions आ सकते हैं. Please understand that here. Some other questions related to alcoholism. First of all, you tell me, every day I used to take 5 pegs and after that I used to get the kick. Now I have to take 7 pegs and after a few months I will have to take 9 pegs. After that I will be getting the kick, right? So what does it mean? It is called as tolerance, right? Okay, fine. Now I'm abusing alcohol for last 15 years. Now if I take only 1 peg, then I'm getting kick. Only 1 peg. This is called as what? Reverse tolerance. Reverse tolerance. Maybe because of supersensitivity of receptors or multiple organ damage. Multiple organ damage. Okay, fine. How much is the driving limit in India? How much is the driving limit? 30 milligram per deciliter. 30 milligram per deciliter. More than 80 milligram per deciliter in blood alcohol concentration. There will be incoordination. More than 200 nystagmus, or alcoholic blackouts. Alcoholic blackout means what? Anterograde amnesia. Patient will say that, how did I get back to my home after the pub? I don't remember. More than 200. More than 300, there can be coma and death. Coma and death. What is the most sensitive investigation for alcoholism? Batao kaun sa tha? What is the most sensitive? Kaun sa tha? What is the most sensitive parameter? Okay, one we have learned related to Widmark's formula. Widmark's tha, Widmark's formula was there, one. What is the most sensitive marker? Kaun sa marker hai? CDT tha na, CDT, right? CDT. CDT, carbohydrate deficit transferrin, right? Remember CDT, this is the most sensitive and specific biomarker for what? Alcoholism. What was the name of the questionnaire system which we have learned related to alcoholism? Kaun sa tha? Cage questionnaire. Cage questionnaire. Easy to understand? Chalo, fine. All these are the questions which you can anticipate from alcoholism. Take one question from alcoholism for sure every time. Second question. Naltrexone is used in opioid addiction because opioid. See, last time there was a question. There were two questions from substance abuse in psychiatry, like in last December exam. One was opioid, one was alcoholism. So इसमें से बताओ क्या है? Related to opioid addiction, remember two drugs only. Two drugs. One is naltrexone, second is naloxone. For relapse prevention, we have to give naltrexone. For overdose or intoxication, we have to give naloxone. बस इतना याद रखो, this is more than enough. Two drugs, naloxone and naltrexone. Naltrexone for the relapse prevention we are giving. Overdose के लिए क्या देते हो? Short है ना? अलग short half life. कौन सा? Naloxone. Naloxone. Please understand that what are the symptoms of opioid intoxication? Overdose. See here. See, there can be what? See, slow respiration, hypothermia, hypotension. See, in the beginning, there will be, see, whenever there will be overdose, no, overdose will be having meiosis. Pinpoint pupil. But what about withdrawal symptoms? Withdrawal symptoms. There will be what? Pupillary dilatation. Withdrawal में mydriasis. Overdose, meiosis. These 2 points yaad rakho, more than enough. Now, what are the withdrawal symptoms in opioid? Flu-like symptoms. Flu-like, running nose, rhinorrhea, lacrimation, yawning and piloerection. All these are repeatedly asked questions. See here, in most of the withdrawals, see, in most of the substances, withdrawal symptoms will be having what? You know, lack of sleep, okay, anxiety, hypertension, tachycardia, nausea, vomiting, everything will be there. Mydriasis, withdrawal of opioid. Meiosis, intoxication of opioid. Opioid like means what? Opium plant, right? Afim, like heroin, brown sugar, smack, right? No, heroin, right? No, and the methadone. Fine. Next. Do understand, out of substance abuse, most important is alcoholism, after that opioid, after that cocaine, and then cigarette. 20-year-old young man is suffering from drug, DRUG hai, okay. Drug abuse presents with crossover of sensory perception. Music can be seen and light can be heard. In which poisoning there will be synesthesia. In which poisoning there will be, patient will say that I can hear light, I can watch music. Synesthesia, depersonalization will be seen in which substance poisoning? Either in cannabis like bhang and ganja, or LSD. Answer is A. Answer is A. LSD and cannabis. Remember, there will be what? Synesthesia, reflex hallucination, depersonalization, bad trip and all. Okay. See, related to, please understand here, synesthesia can be seen in cannabis and LSD abuse. Related to cannabis abuse, what kind of questions? What are the important points? Overall, this is the most common illegal substance to be used in India. Most common illegal. But most common substance abuse kaun sa India mein? See, as per 2019, now it is alcoholism, alcohol. Hemp insanity because see, hemp plants are psychosis because of the cannabis poisoning is hemp insanity. Run amok means what? See, a person who was abusing cannabis a lot, sometimes he will be having aggression, he will run on the road, who will come, he can hurt, even he can murder. That is called a what? Running amok. So here now question is that if a person is going to commit any crime during running amok, he will not be punishable. No punishment because McNaughton's rule. Flashback phenomena, please understand that. Flashback phenomena is seen in cannabis and LSD abuse. What does it mean, flashback phenomena? A person who abused cannabis on Monday, even after 5 to 6 days, what is happening here? See, active ingredient of the bhang or the cannabis will get accumulated in the blood. Okay, no? So what is the active ingredient of cannabis? It is what? Tetrahydrocannabinol. Tetrahydrocannabinol. This will get accumulated in what? In fat, actually. In fat. In fat. After a few days, there will be slow release of tetrahydrocannabinol in the blood. Even after 5 or 7 days, when a person is not abusing cannabis, he will be having same pleasure, same feeling. He will be enjoying like he is actually abusing now. This is called as flashback phenomena. It is seen in cannabis and LSD. Patient does not want to do anything, a motivational syndrome. Bad trip. Sometimes he will be feeling very, very bad. Okay, no? Okay, or maybe like fear, phobia and all. That is bad trip. Tactile hallucination and jet black pigmentation of tongue are seen in which poisoning? Cocaine. Okay, no? See, please remember tactile hallucination, which is also called as Magnan's phenomena, right? Magnan's phenomena. Okay, tactile hallucination, which is also called as formication. Jet black pigmentation, because see, cocaine is also used, cocaine, Dr. Setu, that was actually opioid right now. Okay, fine. See here, cocaine will cause what? Vasospasm or vasodilation. Vasospasm, right? Vasospasm. There will be vasoconstriction. Because of that, there can be ischemia. There can be necrosis. Fine. So there can be black pigmentation over tip of the nose, lips, ear, lobe, and all. Fine. So jet black pigmentation of the tongue is cocaine. Remember cocaine. See, cocaine can also cause seizure. Next, after smoking cigarette, a person gets very attentive. This is because of what? Dr. Sai Swarup, yes. There can be, see, even in the cocaine, see, there can be nasal septal perforation also. Remember all these points, right? Okay, fine. See here that cigarette make, this is related to tobacco. And there, see, this is going to what? Like what is the active ingredient? Nicotine, right? This is going to stimulate dopamine and choline. Okay, now dopamine is a hormone for what? Dopamine is a neurotransmitter. This is a neurotransmitter for kick. Acetylcholine, choline, this is a neurotransmitter for what? Attention. Attention. So when a person is going to smoke a cigarette, after that he will be having what? He will be fully attentive. He will be having what? Like he will be having full of attention, full of concentration, full learning power, good judgment power. So that is because of what? Attention hormone. That is called the choline. Choline. Increased choline. Right? See, please remember here that sometimes they are asking a question related to pharmacotherapy of smoking. How to stop cessation? How to stop what? Smoking. Fine. So you have to give what? Nicotine replacement therapy. Nicotine replacement therapy. Either you can give nicotine gums, patches, inhalers or spray, but never IV. Never IV. Some medication, anti-smoking drugs, bupropion, which is actually what? Noradrenergic, dopamine reuptake inhibitor. When you give bupropion, it will increase dopamine, which is going to replace the nicotine activity, no? Right now? Fine, no? Vernicillin, it will not let to happen what? Kick and craving again. Fine. A young girl loves to wear male clothes. It gives her a temporary pleasure of being a man. She does not get any sexual pleasure and does not insist for any sex surgery. This is called as what? Related to sexual disorder, please understand. Very, very important. See here, if a boy or girl is not happy with the genital organ, that is called as gender identity disorder. Gender identity disorder. If gender identity disorder persists in male, in adult male, and now he is not happy. Suppose if a man is not happy with his genital organ, he is insisting for surgery. He's saying that, no, I want to become a female. This is called as transsexualism. Transsexualism. Where frequently he is using a phrase that I am a man who got wrapped in the body of the woman. Transsexualism. Fine. Now, there is something called as a dual role transvestism. Dual role transvestism. One more thing is there that is called as only transvestism. Transvestism. In transvestism, what is happening in transvestism? When a person wears the dress of opposite sex, he will be having sexual pleasure. He will be having orgasm. That is called the transvestism. That is a type of what? That is a type of paraphilia. Paraphilia. But in dual role transvestism, if a person is wearing that dress only for time being, just for the temporary feeling of being opposite sex, no sexual arousal, and patient is not asking for surgery, that is called as dual role transvestism. Transsexualism, patient is asking for surgery. Transvestism, sexual arousal. No surgery, no sexual arousal. Dual role transvestism. Dual role transvestism. Answer will be C. Erectile dysfunction is a disorder of which phase of sexual response? As we have learned that when a man and woman wants to have sex, first of all, there will be what? Desire. Okay, no? Desire. After that, there will be what? Excitement. After that, there will be what? See, after that, there will be what? Orgasm. And then there will be resolution. So when a man and woman wants to have sex, yes, there will be excitement. How to understand that male is excited? There will be penile erection. How to understand? Female is excited, there will be what? Vaginal lubrication along with increased heart rate, respiratory rate and all. How to understand? See, after that, when they will be excited and finally there will be what? Orgasm. Orgasm means what? Male mein kya hoga? There will be ejaculation in male. In female, there will be what? Involuntary contraction of lower third of vagina. So see here, there will be erection during excitement phase. There will be ejaculation during orgasm phase. So I'm saying that a man can have erectile dysfunction. Erectile dysfunction. So erectile dysfunction will be the disease of excitement phase. Excitement phase. When I'm saying that a man is having premature ejaculation will be the disease of orgasm phase. Easy to understand? Easy to understand? Chalo, fine. Okay, so in this manner, we have completed entire psychiatry.